I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Roll call attendance, please.
Mary Jo Rafanowski.
Here.
Mary Jo Radcliffe. Here. Patty Jacobson. Here. Troy Webb.
Here.
Amy Huffman. Here. Ann Deemer. Here.
Okay, has the meeting been notified to the public according to open meeting law?
Yes, it has.
Thank you. Okay, we have one agenda move to 8.1 to be at 6:30, as we have people who will be joining in the conversation. Is there a motion to move 8.1 at 6:30?
I make that motion.
Thank you. Is there a second?
Second.
Second. Okay, all in favor say aye.
Aye.
Aye. Okay, thank you. We're at public comment. Is there anyone who wants to address the board of something that's not on the agenda? Okay, we'll move on to community engagement. We have some gifts that we need to look at and accept.
Excellent. So this month we are very pleased to accept 2 separate gifts. One of them, as we talked about before, Jen Dahl, our elementary art teacher, has a very, very old, longtime friend of hers that just loves the work that Jen does with our students. And so every year there's a donation for something that Jen is doing in her classroom. And so this year there's $500 for Jen to use for elementary art supplies. We're very appreciative of that. Black River Falls Municipal Utilities has once again donated $1,000. This is like the 3rd donation from them since last March probably, and they would like that to also go into our angel funds for negative meal balances. So we're very appreciative of that. I will share that we just got in the mail today that I was going to bring up, help me with the name, it's a second chance ladies softball organization from the Whitehall area, and they make a donation each year, and there's just a really beautiful letter that says, we hope this donation, we are confident this donation will find its way to somebody who is very deserving and appreciative, and there was a $100 check, and they've done this for the last couple of years as well, and so we haven't designated those funds yet, but also would like to recognize them with some appreciation. So
Great. How are we doing on our outstanding lunch balances? Do you know?
well, yep, I gave an update a couple months ago, and I would say that we haven't had a lot of movement since then. Because there's no fee for the meals right now, there's not a lot of movement on those payments right now. We did have a couple of seniors finishing their programs, their 5th-year seniors, and so have collected some fees there, but not a lot in the lunch.
If somebody gives a general donation for that fund like that, how do we allocate it?
So we have an internal process where we prioritize seniors first that have been, particularly if they've been working on paying it down, and that would be some additional help. And so we've kind of developed an internal process that those funds, and there's still several $1,000s in those funds because there was that large push last school year to grow that, and then this year there hasn't been, well, since last March, there hasn't been a lot of balances accruing, and so.
Okay.
Yep.
Is there a motion to approve the gifts and grants?
I'll make that motion. A second.
Thank you. Any more discussion or questions on those? All in favor say aye. Aye. Opposed? Okay, motion carried. Instructional model decision making.
That was both, yes, sorry. I would like to table that if we could until the next meeting.
Okay, make a motion to
I would
table.
make a motion to table that item.
Okay,
A second.
any questions, comments?
My one question would be, is there background information that you are looking for from me before the board has that discussion?
If I find any, I'll let you know.
Okay,
I'm just not
perfect.
prepared yet this morning.
Perfect.
Okay, we have a motion and a second to table instructional model decision making. All in favor say aye. Aye. Opposed? Okay, we'll table that. Move on to our people, focus on purpose. We have the high school math people to.
And we have 2 here physically, and we have 2 here via Zoom.
Oh,
so
good.
we're pleased to welcome everyone together. So. Do you want to move your bubble while they're presenting?
So that just picks you up for the video. You won't really.
Oh.
It doesn't really amplify,
Yeah.
it just carries it through to the live stream, so that comes through loud and clear. And I do have a speaker, I do have a speaker attached to my laptop, and so your voices will carry through the room as well, okay?
Jared, just make sure that the green light is on.
He tapped it, yep.
Okay, let's get started. So just first of all, an introduction of the team. I am Jared Plaza, the PLC leader. This is my 6th year in the district.
My name is Emily Shane. This is my first year actually teaching altogether, so first year in the district.
My name's Atlanta Stanton, and this is also my first year teaching.
My name is Teresa Delph, and this is my first year teaching at Black River Falls, but I've been in education for 16 years.
They cannot, well, if I move, I bet you can see.
Do you want them to go through?
I mean, just a quick little background. I'm not sure how many of you members have met the brand new folks in the department. So.
In the year of COVID, not a lot of people have met a lot of people.
Yeah, so when we have 3 new ones, I figured it'd probably be a good idea for them to give you a little bit more background information about themselves.
See the screen,
so,
right, ladies?
Teresa, I don't know how well you can see it, but if you wouldn't mind just kind of giving a little bio.
I can see it. I live in Sparta with my husband Paul, who's actually cooking dinner for me now. He's trying to give it to me, and I'm like, no, not yet, right? Not just yet. I live with him, my dog Becca, and my stepson is joining us at the end of December from Virginia. My daughter Lainey, she goes to Duke University and she's studying business, and then my stepdaughter Veronica, she's at William & Mary, which is also in Virginia. As I mentioned, this is my 16th year teaching full time. And as a teacher, especially a math teacher, one of my goals is to really promote my love for math and just to encourage young people to find, I guess, jobs in the STEM industry. I just would like to see more young people love math as much as we do, and move in that direction. I think that's it. Oh, my fun fact, yeah. So I have a red belt in Taekwondo. I used to compete in college. It's been a while since I've competed. And that's me.
Excellent. Thank you.
All right, I am Emily Shane, originally from La Crosse, Wisconsin, but I did just move to Black River Falls, and I love it. This is my first teaching job, but I am a lifelong learner, and I hope to share that passion with my students. I am certified in actually both math and English, and then my fun fact is that I'm really crafty, so I will bring that creativity to the classroom.
Thank you.
Hi, I'm Atlanta Stanton. I live and am reporting to you from Melrose, Wisconsin, with my husband Dustin, and then I have a 5th grade son, Jack. This is my first year ever teaching too. It took me a little longer than some to figure out what I wanted to do when I grew up, but I figured out it was teaching, and I'm happy to say that I'm so happy to be in this school district, first of all, but I've definitely found the job that I love because this is where it's at. I love this teaching thing. I decided to teach because my high school years and that transition to adulthood was not ideal, and I understand that there's a lot of turmoil that comes with it, and I want to help guide young people through that, in addition to help them get through one of those tougher subjects, which I happen to love, which is math. And my fun fact that my students know well, I get called the goth math teacher quite often, but I only wear black. And I kind of plan on trying to blow their minds one day by wearing like all pink or something.
I wouldn't recognize you if you did that. So just a little bit of background work about what we have been doing at the high school. In 2016 through 2019, we participated in a math grant with UW River Falls. Mary Repka, you can attest to that. It was a lot of time, but a lot of learning that went into that. We went multiple times in the summer, weeks at a time, 1 week at River Falls, 1 week at Eau Claire, multiple times throughout the year for a Saturday at River Falls. And then we were also one of the centrally located hubs where they would come to us once a month on Wednesdays. And a lot of that was just realizing the purpose behind the math. A lot of why do we do it, not just what we do. So a lot of what we've taken, of the 4 of us, the math teachers, I'm the only one that was lucky enough to participate in that. But we took a lot of things that you can see in each of our classrooms. For instance, the 8 mathematical practices that were very, very common and prominent in every single one of those discussions. So in 2018, the discussion started with how can we take these practices and put them to use in our classroom. And it started with, we need a change of textbooks. Our textbooks are old, they are outdated, we need to take what we are seeing here and be able to provide that same knowledge to the kids. And so we spent a long time reviewing our resources and settled on CPM, which is College Preparatory Mathematics textbook. We have the textbooks from Algebra 1, Geometry, Algebra 2, and Pre-Calculus. And we are in a 3-year rollout with that. So last year was year 1, where students were put in Algebra 1 or Geometry. This year is year 2, where Algebra 2 is being taught via CPM, and next year, year 3, will be Pre-Calculus. So we implemented new CPM resources. A lot of what CPM is group work, group tasks, and there was some fighting that was involved between the teachers and the students, but ultimately it does pay off when there is buy-in across the board. So a lot of resources, a lot of building things in your classroom, really getting those kids engaged and hands-on learning. This year has been a struggle because if it is centered around group work and we cannot do group work, then what do we do? So there's been a lot of conversations back and forth with a few people that work with CPM. Last year, her name was Tracy Frank. She was a CPM coach. She came and viewed each of our classrooms and how we were implementing things and some ideas and suggestions. She no longer works with CPM, so now we have a new guy who I do not remember his name. Jeremiah. So we've only met with him once. But losing 3 of the 4 math teachers meant that we had to kind of start this learning process over. And for ways for me with teaching virtually, I'm learning the process over. We were able to go to a conference in Eau Claire last year multiple times. This year they went to virtual, and they have it implemented in phases based on how comfortable you are with teaching the content. So next year I'm hoping that we can be back to in-person that way. The 4 math teachers can go together and really see how it's supposed to look in a nice classroom setting where there are no restrictions. So I did talk a little bit about this as well. CPM, what it stands for is College Preparatory Mathematics. It also stands for the CPM's 3 pillars, which is cooperative learning, problem-based learning, and mixed-based practice. This answers that age-old question of when are we ever going to use this? The textbooks were written by educators, which is one of the reasons why we looked into this. A lot of the story problems that you see actually recur over the course of 3 years. So students will recall, oh, I remember seeing so-and-so back in Algebra 1 and they're in Algebra 2 2 years ago. So that's very, very nice. Also, they have a mixed-space practice design, or a spiraling design, meaning that, and Emily can talk a little bit more on this since right now she's teaching CPM and I am not this year, but where there's a lot of review and preview happening, where the kids get practice every day on the skills, get to review what they just saw, and also get a taste of what is going to come. Emily, do you want to talk a little bit about this, please?
Yeah, so when we do work in teams, there are 4 roles. Ideally, we have 4 students, sometimes ranging from 3 to 5 in the group, but each student is assigned a role. So the first one is our resource manager. They're the ones who are mainly in charge of gathering supplies, making sure the team has everything, takes care of everything they need to by the end of class. And they are the one who gets to determine whether they call the teacher over to answer questions, because really the focus is we want students to work with their peers, elaborate and develop their own thinking, see each other's perspectives before they reach out to us, the quote-unquote all-knowing teacher. So the other, another role is the facilitator. This is the person who says, who wants to do this? Who's going to take the next role? They kind of make sure things keep moving, is really their role there. And stop and check to see, does anyone understand or not understand what's going on? Another one is our recorder. As their name states, they are the ones who get to report back to the class, maybe at the end of class where we have a full group meet where we talk about what they've explored, what they've discussed. And they're also the recorder. The recorder shares out, and then when they're the recorder, they write down what's happening in the group. Their focus, they all have kind of a quote focused question. Theirs is how. How do we do this? How do we make sense of it? And then the last one is our task manager. So they're kind of the one who makes sure that they stay within that group. They don't reach out to other classmates, which is sometimes a want and a desire. But really, we do want them to develop those skills and kind of those relationships too. So it does help keep their groups on task, and then also listens for statements and reasons. So they're the ones who ask, can you explain that, or why do you think this? So those are our 4 roles.
And Lana, Teresa, how'd that go? Anything more that you ladies want to add?
Sorry, had troubles unmuting. Emily nailed it. That English teacher. Nailed it.
Right? Yeah, she did a good job.
So the great thing about these team roles is when we can get back to a normal classroom setting, there are STTSs that we can use. So they're called Study Team Teaching Strategies. And so it takes these roles and it utilizes them in a way where it makes the learning a lot more engaged, a lot more fun. They can get up, they can move around, have conversations in different ways, different activities that are based around these roles. One of the purposes behind these roles is just understanding that there are many different parts to a complex problem, and being able to see it from all these different angles and to get an experience in both of them can both highlight your strengths, they can build up your weaknesses, and they encourage collaboration.
So have you been able to use this format at all this year?
Very, very, very little. Earlier
I've
on,
done a little bit recently, just in the past week. I've done it in 3 of my 4 classes. The problem is that the classes are only 35 minutes. And so by the time you get into what you're supposed to solve, and then you get them into their breakout rooms, there's only 15 minutes left. And to perform this type of collaboration, you need a little bit more than 15 minutes. But it's doable with a small group activity, with a short group activity.
Thank you.
We've been able to utilize the breakout rooms in Zoom. Occasionally, that we've had some success with that. I've been able to do it once. It's a little tricky just because then we have to make sure that we're hopping in each room, but that's been the biggest technology help that I've found anyway, and I'm always looking for those. So we're trying to make sure that they get that collaborative piece, because that's the part that I think makes it stick for them, is being able to explain it to themselves and then have to process that and explain it to their peers. So it's something that we're really trying to hit, because we know that really helps.
And speaking from an experience of a year of having it in the classroom, when there is buy-in wholeheartedly from the kids, from the parents who learn about the resources, from the teacher, it is a well-oiled machine. And it takes a while to get there, but it pays off wholeheartedly. So this is Wisconsin's vision for mathematics. There are kind of 4 different quadrants there. That's one of the reasons why we really look at CPM, was we think that every single one of these quadrants, CPM really addresses the coherent, connected, I talked about how a lot of those story problems take place over the course of several years. Interesting. Once again, answer that question of kids, when are we ever going to see this? When are we ever going to use this? Get those hands-on story problems. The kids get to engage in all these different activities, hands-on, rigorous activities that aren't just solved for X. All the problem solving, because the problems outside of a math classroom are not, you're walking down the sidewalk and there's a problem that says X plus 2 equals 8, solve for it. It's real-life applications that really do focus on that collaborative piece. Because that's a big weakness from a lot of our students these days, is understanding how effective collaboration can be. So this is a snapshot as to how things look in a math classroom this year teaching virtually. So
if you look at the lower right-hand corner, that is actually an image taken straight from the digital notebook that I've been using with my Algebra 1 students this trimester. And while we're all still adapting to using this new format for learning, some of them haven't figured out how to create a line in Google Slides yet, but we are building up those skills, taking time in class to talk through that, and we have found that it is nice to kind of have one spot where their homework, their notes happen, So it has been nice in that sense. I direct them to the digital notebook, and they know they're going to find what they need.
Did you want me to go back?
Yeah.
Sorry.
And if you ever get a chance to go in there, it is literally the most colorful, beautiful, most organized thing in the whole world. So it is like aesthetically pleasing to watch Emily doing all this organization. So it is terrific. Teresa, do you just want to talk a little bit about how things look in your room?
Sure. Well, I like to start off by opening Canvas and showing the students where they need to go for the day to get their materials after we meet. While we're meeting, I use the document cam to teach the math, to actually show the process. I like it. I like the document camera because I find that math is very fluid. They can actually see each step as I progress through a problem. So I'm looking forward to the additional 20 minutes that we'll get, 25 minutes, because the 35 minutes is hard to do, you know, all of the practice problems that you need to do in a class period. But anyway, the document camera is very helpful.
And Anna, do you want to talk a little about yours?
Sure. So I got a little snapshot of my iPad up there. So I guess it's just a little step up from the document camera. If you consider little being able to add like videos and pictures instantly. I've been really enjoying, I used this program all through college when I was taking notes and stuff, and it was so amazing. So now I get to do that kind of live note taking with my students, but that app that you're seeing is actually, it's a window that floats over my other app, so I can actually show them that in addition to other things. So it's just adding this whole nother level of fun techie stuff that I can do. And as much as Emily is very organized in her digital notebook, I am very doodly in mine. So I get to, I like how Teresa described it as fluid. I get to be fluid with my note taking with them and the colors, and it's fun. I really appreciate that I get to use that bit of technology. I like technology, so I'm kind of in my element there. But yeah, that's a snapshot of what I use.
And then how I approach, I teach the calculus and pre-calculus classes. I would love to do something a little more like the doodly pretty, but when a calculus problem takes 2 pages to complete, I'm a little limited. So I have a screen recording website called Loom, and it actually is used quite often within the district here. And what you're able to do is you're able to record yourself, different screens, different things. So I record a lecture, that way I can really get the point across. Talk about Teresa mentioning fluidity, kind of the same thing where I am recording that every morning and sending it out to the kids. That way they have a chance to see a problem in its completion and bring questions that they have back later on. It works very seamlessly with Canvas, being able to upload the videos. So I can see which students have watched them. I can embed them in different areas. It's very, very unique. So just a couple of highlights that are happening right now or about to happen. So this year we've also started a Math for Tech Trades class. You can earn credit through CBTC. Also with the high school going to cum laude points, they can also earn cum laude points as well. So they actually just got registered for that for the second trimester. So it is the first year with that. More to come in 3 years when I see you guys, right? Also, we are moving to standards-based grading as a full department. Last year, we started to dabble into that, and I decided to jump in with both feet. And so this year, we have people kind of dabbling in different areas, with Emily in Atlanta joining right away and getting a taste of that, and Teresa joining us in November and getting a taste of that as well. Getting the students to really understand the purpose behind why we do it and what it means, and that their grade is more than just a number. It creates the most rewarding conversations you can possibly have. Also, just like all the members of the department have talked about, we are finding new ways to explore all the different various ways of technology and implement them in our daily lessons, and how we can incorporate that into our math classrooms. And then, like we mentioned before, our CPM trainings, hopefully we can get back to in-person, because the in-person experience that I had last year with the other department was second to none in seeing how it should look in a classroom, and I pray that these three can also receive that next year. So then where are we going? So because we've had a couple of changes in the math department over the last 2 years, please don't leave. We've had 10 teachers in the last 3 years in the department, so trying to get course guarantees built from people who've actually taught the course, our experience and knowing what did we hit, what did we miss, what do we need to cover, what gaps do we have. It all starts with consistency. So this summer, us four are going to sit down and hash out exactly every single course. What have they seen? What are they missing? Where do they see it? How can we address this? Looking forward to that because we have quite a few partially complete curriculum maps that we'd like to just get one nice firm one. Also a couple of new courses that we are looking into. Statistics is happening next year. Hopefully, all things considered, we already have the textbooks available. And then an intro to computer science class. That's kind of trying to keep up with the times here. I'm not devaluing any of the courses that we already teach, but I think that a computer science course based on what is happening in 2020 and beyond might be more relevant for a student to take place than a, say, calculus class. So that is something that we are looking into for the very near future. And I believe that is everything.
Does anyone have any questions? Thank you. I love the creativity that we're hearing about how you've made the adjustments for the virtual teaching. We always just wonder how that happens, and
It's great to see that. I mean, and that's just a snapshot within our department.
Yeah.
If you walk down the hallway, the science department is doing their stuff 4 different ways. It's completely different from us, and you are adjusting on the fly and what the kids need, and it seems like you're trying something new every single day, and it is absolutely amazing to see the amount of collaboration that teachers are giving with each other outside of this school, things that are working with, your friend teaches at this district, what's happening there, what's working there, and the amount that we are able to share and learn from each other. And even the students are very understanding that if something doesn't work, a lot of them have been very honest with us back and say, can we try something that looks a little more like this? So the give and take has been terrific. It's not an ideal situation, of course, for anybody, but we're making the best of it, absolutely.
Would there be a way for us to kind of watch what happens with any of this?
Absolutely. Absolutely.
That's kind of interesting.
You mean wanting to go in and watch a virtual teaching, or what?
I mean, not be there physically present, but just watch what's happening with how it all works out. Whether that's live or recorded, and I don't really matter, but.
So Mary Jo has had already asked and has gone into the schools to watch one side of the virtual teaching. We certainly could set up some opportunities if other board members are interested in that same thing.
Yeah, I'm sure that there are many people who are anxious to highlight, what's happening in their classrooms, and would love to share it out with you. Absolutely.
I had a question about the teams that they work in. Do the students take turns in different roles in that team thing? Is that kind of?
Yep, absolutely. When it all depends on the unit that you're in, the class makeup. But when it was ran last year and everything was nice, and we want to have the kids really understand the role and be able to utilize it in multiple class periods before switching. So sometimes you would wait. We did a test every 3 weeks. So last year I would have a group of 4 together, and then after 3 weeks you would become a new group of 4. So in that 3-week span, you had to be every about 3 days. You become a recorder, reporter, these 3 days. And then you kind of rotate. So we kind of spin clockwise, if you will. So you get a chance to see it for the first time, get a chance to practice it, get a chance to kind of finalize it, and then rotate. So you're still within the same group, collaborating with the same people, but in a different role. And then after a 3 weeks period, you get back into the same role you were in recently, but now you're collaborating with recent. The makeup provides a whole new challenge as to how you work problems.
How do you address different levels of learning, or people proceeding at different paces?
That's a mixture of what we are doing, asking the guiding questions, as well as them learning from each other. There is support in there for any students who do need it from some of the aides, but it is our job as the teacher to not stand up and lecture for an hour. It is our job to set the pace and then go around asking guiding questions and kind of gauging where the students are at in their learning, understanding that we're going to have people who are here, and people who are here, and people who are here, but us being able to circulate and see, okay, this kid is really, really strong at this, but not so strong at this. We can take their weakness and turn it into a strength by utilizing those STTSs that I mentioned, those study team teaching strategies. where we can pair them with people who maybe I know that they are comfortable with, they are friends with, who their strengths kind of feed off of each other. So learning from the teacher, learning from each other, learning through that collaborative piece, the gaps definitely closed, and that was very apparent last year.
And something that I did in my
There,
class.
I could add to that, that when the kids are working in groups, oftentimes they come up with questions themselves. In a more traditional setting, students aren't as apt to ask questions, but when they're working in small group and in a collaborative, collaboration like this, they feel a little bit more empowered to be engaged and to ask questions, which of course helps their learning.
Plus, they're not sitting back passively, just not participating. That's what I like about it.
Exactly.
They're actively participating.
Yeah, and one of the really easy things that I would do is when we move into small group settings, I'd always say, okay, someone in your group needs to read the problem. So because I had a handful of students spread out between my classes that really struggled with that reading portion, and with the level of applicability this book has, the word problems that are involved, there is a lot of reading. And so once students got into that routine, I wouldn't even have to tell them, and one of the kids would jump in and start reading the problem right away. So there are little things that we can do to lift everyone.
On the other side of, on the other side of that, so for the students that might be maybe chomping at the bit and wanting to move ahead and needing some differentiation there's that real ability to put them in a leadership role, which does wonders for students who are feeling like maybe bored with the content or something like that, but just putting them more on their plate, so to speak, and having them explain things to those students in their group, their peers that aren't quite understanding, it just totally takes it up a level for them too. So we're able to hit both sides of that differentiation using groups. It's awesome.
Yeah, everyone then is spot on. Like for instance, and I think what Atlanta has talked about, one of the STTSs she just mentioned is called Ambassador. And so if you realize, like, all right, this group is doing a terrific job, they're kind of done twiddling their thumbs. What I can say is I can go over that table silently and pick each one of the 4 students who may be in this group and say, okay, you're going to go work with that group. You're going to work with that group. Tell them what you found. Show them a different way of thinking about it, and sometimes it can spark their thinking. Or we can do a swap where, okay, every reporter stand up and rotate, and all of a sudden you're bringing a fresh idea. So you're right, it's not a stagnant, I'm going to sit here for an hour and listen to a lecture and just work on problems. There are a lot of applicable resources that we utilize, but honestly, a lot of that comes with, okay, I know that those strategies exist, but when do I use them? And that textbook, and Emily, Atlanta, Teresa can all attest, it is almost like a script for your first year, where it kind of highlights, hey, if you're going to use a strategy, maybe try this one. But later on it says, you should try a strategy here. So it almost is teaching you as you're teaching them when you can utilize the strategies and when they are most effective.
Any other
Yeah,
questions?
we know in math that there's always a correct answer, but there isn't just one way to solve. So this really helps promote that idea that you can tackle a math problem different ways.
Well, thank you very much. Your enthusiasm is great. Thanks.
Thank you very much.
Thanks
your
for
time.
sharing.
Thanks for
Yes.
coming. We appreciate
Yes.
it.
Thank you very much.
Thank you.
Thank you, ladies. Enjoy your dinner.
Bye, thank you for having us.
Okay. Okay. Next item, we're going to move down to 8.1, the WIA return to play recommendation.
And so if I could share with the board, at our special board meeting on December 7th, I hadn't prepared for us to have a thorough discussion on the WIA recommendation or our local recommendation. At the time, I shared that with you, basically just that you knew what we were sharing with our students and families, and so it took me a bit by surprise when action was taken on it, which is your right. But since that time, it has left us in this unique situation in that we don't have a protocol for athletes who have tested positive and how they would go about the opportunity to go back to play, because WIA does have some recommendations, and Dawn Jacobson, our trainer, and I should have introduced beforehand, Dr. Del Rogers is the district's medical advisor who is joining us via Zoom tonight, and Dr. Michelle Forsting worked with Dawn Jacobson on that return to play protocol. And so, as I said, I was not prepared to give you any of their rationale at the time, and we heard from board member, but it felt appropriate that those that worked on the document themselves and those that are going to be asked to enact the document be given the opportunity to also share their thoughts. And so, just to be very clear, protocol, Robert's Rules of Order here, if the board, I would hope that you would welcome our guests and allow them to share their thoughts as well. And if the board is interested in doing something differently, we'd actually have to rescind the previous motion. If you are not interested in doing anything differently, we're gonna have to have another conversation as to what do Black River Falls athletes do in order to return to play in WIAA. So I don't know if we want to start with our medical advisor, Dr. Rogers, or with Dr. Forsing, who helped to prepare that protocol.
I'm open to starting with Dr. Rogers.
Dr. Rogers, would you mind sharing your thoughts on that protocol?
Yeah, thank you. Thank you very much for having us. Appreciate the opportunity to come and talk, and sorry I wasn't available at the prior meeting to talk about it. Having talked with Michelle and talked with Dawn about the protocols, we are very concerned about how we're going to send our athletes back in a safe manner, giving all the information that's starting to come out about COVID infections. So Michelle could probably speak to a little bit more of the sources she used to kind of come up with the return to play from with Dawn, and I would defer that to her. But I think from a medical evaluation standpoint, with the new guidelines set down by the WIAA, you're going to see that this mimics them almost entirely, very similarly, in the same sense. And that if we're going to send an athlete back to play, from a minimal standpoint, medical legally, you're going to have to need a leg to stand on. And if you decide to do something different than what our protocol has come up with, then I think we need to be able to defend that. And from what I understand from the last meeting, we don't have that leg to stand on right now. So I would defer to Michelle to kind of maybe talk a little bit more about the protocol, but that would be my input on it.
Thank you.
Yeah, thanks for letting me speak. So I'm assuming it's okay for me to go ahead and talk? Okay, very good. So the information that we have about COVID and athletes, so everybody knows that we're lacking lots of information about COVID, right? So we're just learning as we go. But the information that is out there is pretty clear that we need to at least be aware of the possibility of myocarditis, which is an inflammation and infection of the heart tissue, and particularly related to athletes. Myocarditis can cause issues with electrical conduction in the heart, and worst case scenario, sudden cardiac death. So clearly we don't want that happening with our athletes. That's one of the reasons why we do sports exams before athletes start every year or every other year. And that's one of the main reasons why we do it. And so there is not too much information, and admittedly much of the information is extrapolated from what we're finding in adults and how the cardiac tissue is being affected by COVID. That being said, and if you look at WIA's website, they have a couple of the literature sources right there, as the sources of what we used for our protocol development. And so that would be, there was a paper put out by a task force, I guess like an expert task force from the National Federation of State High School Associations and the American Medical Society for Sports Medicine. And the interesting thing is my understanding is there's concern, is it burdensome if a kid has had a positive COVID test for them to be evaluated? It says in numerous areas pretty explicitly, and so this article recommendation says explicitly, every student athlete with a prior confirmed diagnosis, positive test for COVID-19 should undergo an evaluation by one's medical provider prior to sports participation. And that doesn't mean that they're going to have some extensive workup. If you look at our protocol, what it means is that they're seen and evaluated by a provider, and by that it's MD, DO, NPPA, and before they're cleared to participate in a 7-day return to play protocol. And I've seen that in numerous sources now. The WIA form itself says the exact same thing. And so while they didn't have their information up when we created our return to sports protocol, it very closely follows the same recommendations based on the same information. I think the reality is, you know, why do we want to take a chance with our athletes that they're going to have something bad happen when it's pretty unburdensome to have them see one of us for a quick 15-minute sports exam, decide if they are appropriate to have any additional evaluation, such as an EKG if they've had a moderate illness, or were they really sick? Did they end up in the hospital, and do they actually need to see a cardiologist and have further evaluation? And frankly, I don't think it's fair to put Dawn in that position to have to make that decision. That's practicing beyond the scope of her license, and while I really like what Dawn does and I appreciate her immensely, I don't think we should have to let her make that decision. That's not fair to her either, to put her in that position. So that's where the information came from. I'm more than happy, I mean, y'all can find it on the WIAA website about COVID-19. I'm more than happy to share, you know, the sources that I use. They were the same ones that all of the other societies have now used to create this. Pediatric Sports Medicine, American College of Cardiology, everybody's recommending the same thing. So we're just basing our recommendations on evidence.
So we have, Dawn, would you like to speak now?
Sure. I don't have a lot more to say within what they did, but I guess I would just echo that when this all came up, you know, we didn't know what to do, and when I had approached Dr. Forstein about it, I was really excited to find that they were already developing something on their end before I had even contacted them. So simultaneously, we were both looking at a lot of the same resources. And, you know, I today, as reviewing before I came here, I found probably 7 or 8 of the major medical organizations. Every single one I searched today, their statement said we're recommending a medical provider, and as Michelle, they're saying MD, DOs, NPs, every single one said the same thing. We're recommending that athletes be evaluated by those providers prior to return to play. I honestly couldn't find a single organization that said differently. And so from my own standpoint, I know I am not a cardiologist, and so if we take the doctors out of this mix, that liability comes on me as the one who ultimately is clearing them, and I ultimately don't feel comfortable making that call. That's not my training. I'm trusting that they're going to be evaluated by one of our medical providers, and then when appropriate, then I will take them through the graduated return to play process. But even with, I've had 3 people go through it so far, and 2 of the 3 in middle of the process have had some level of chest pain during it, and I've had to call the providers back and bounce it off of them. And of those 2, they had both had EKGs done, so it was very comforting to know that they had. The third one did not have problems, and he was not asked to do an EKG by the providers because he had had a very mild case. They determined it wasn't necessary, and he went through it smoothly with me, so that that extra expense was not just blanket given to all of them if it was determined that they didn't need the additional cardiac testing.
Anyone have any questions or comments?
Yeah, I do, because I was the one that objected to it. I worked at the clinic, and I know both of you, I don't know if you can tell who I am with the mask on. And the reason I objected to it, and after our last meeting, I went back and looked at the data. And there are a lot of recommendations for medical evaluation. What concerns me is the way the disease progresses and the timing of the evaluation and whether we're doing things in our database. I could certainly see doing this for people who have had severe disease or even moderate disease. What I'm concerned about is that asymptomatic people. So if you really wanted to do a good evaluation, the myocarditis or the multi-system inflammatory syndrome in children occurs usually 2 to 4 weeks after they've had the first symptoms. And so you'd really want to delay that at least to 4 weeks, right, to be absolutely safe. That's when you should make sure they're clear and free of that illness. I don't think that there's any indication that if you clear them at 10 days, they're not going to show up with that 2 weeks later. So that part bothered me some. I can, again, certainly see that people who have severe illness should be evaluated before return to play. My concern is mostly with the asymptomatic students with mild cases. Also, the incidence of that is about 0.4% in children who have had disease that was measurable, moderate, or severe, the incidence of myocarditis or the multi-system inflammatory syndrome is 0.4%. That doesn't even mention who got it that wasn't asymptomatic. So the risk of it is so tiny. And we're asking people to make this. So first of all, I don't know how quickly the clinic or anyone can get them into these scenes. So if you want to see them in 10 days, are they guaranteed to get an appointment that day to get back to play? You know, the other part, and not just that, but it is a hardship for some people. What is the cost of an appointment for a 15-minute appointment now? I believe it's well over $200, and if they're paying for that, that's expensive. So the final thing is, I don't know how many children wouldn't become symptomatic if they followed this staged return to play protocol, which is excellent. I don't know if any of you have ever taken care of children with myocarditis, but they're almost always asymptomatic. They almost always are sick with it. And so I guess that's the issue that I have. And I didn't mean to suggest that Dawn should be doing medical evaluations at all. What I was looking at is the first part of the graduated return to play checklist. And it looks to me like it does not require a physician to do that, certainly a healthcare provider, someone who could maybe listen to the heart and everything, but I don't know that it would necessarily require a physician or a person at that level with that intensity. There's not, as you mentioned, there's mentioned in a lot of data and research all about this syndrome. The recommendations all say shall, could, would, may. And, you know, I think that that's not hard data, just as Dr. Forsting mentioned. It's not hard data, and we're making this recommendation with not complete information. So I guess that's the objections that I had. I think if we're going to do it, we should do it correctly. And I think that if we're going to do it, I would start, you know, with a evaluation of some sort that maybe a nurse, a school nurse, someone could do, unless we're going to set up a system where these kids can be seen immediately.
So the last time you were very concerned about the testing process, and now I'm hearing more concern about delaying the kids' return to play.
I'm also concerned about the testing process because PCR tests are not guaranteed of disease or infectiousness. They don't measure viral loads in this country. And so we're measuring what somebody breathed into their nostril. The idea that whether or not they determine the disease or get the disease or can pass it on is not known. It just says it's there. So we have a lot of asymptomatic people that are being tested positive. You can go out and test them again, they'll be negative the next 3 days. The other alternative would be if you have a positive test, do an antigen or antibody serum test where you know that person has developed some sort of response to the disease. And I don't know if that could be part of the protocol. So if they test, you know, positive with a PCR test, come back 3 days later and do an antigen antibody test, then you know they've had a response to that virus. And does that make any sense to the doctors there? I don't know if it can hear
Not
me.
entirely. Not entirely. I think we're talking apples and oranges. I think the type of test for the science community we have really doesn't matter. You're talking about something as relevant as the color of my socks. If a patient tests positive for COVID, they test positive for COVID. And for the purposes of our small town, if you talk about incurring expense, if you're going to have somebody come back every 2 to 3 days to change the type of test they're getting, I don't think that's practical. The other thing is, nobody has said that the patient needs to be seen at the Crone clinic. I think we could have any medical provider in town, given the form that we've created, see these patients and release them if an appropriate medical evaluation has been done. To put that on the school nurse, who I'm sure already has enough on her plate as it is to say now she has to clear athletes when that's maybe not her area of training, I don't think is fair either. Again, I still think you are going beyond the recommendations of the WIA, and it doesn't say could or might. It says every athlete with a prior confirmed diagnosis should undergo an evaluation by one's medical provider. So if you're not going to follow WIAA protocol, I'd like to know what protocol you propose that's going to be superior to that.
I would say that there are a number of different issues here. So you're talking about protocols. You're assuming that parents have no role in this. So it would seem to me if you can make a strong recommendation to have a medical evaluation, the parent could decide to do that or not decide to do that. It's putting the responsibility back where it belongs. I believe I emailed that to Jay earlier. I don't know that it is up to the school board to demand that parents treat their children in one way or the other. I think most parents will do what they feel is good for their child, and if we make a recommendation that they be checked by a healthcare provider, that would be a very strong recommendation. I think that would certainly protect you medically legally. I don't think it has to be a mandate. And I'm sorry, I didn't mean to imply that people had to go to the Trump clinic. That was not at all the point. I mean, healthcare facilities all over are clogged up and people aren't able to get in to get care. So making this additional requirement rather than a recommendation, I think, I'm not sure, given what we know, I'm not sure based on good data or good information. And the testing is different, and I have a number of articles that I would be happy to share with anybody who wants to see how the testing varies.
And I think we can always see the opposite side of everything. And as I said numerous times at the last meeting, I think it's irresponsible not to take the recommendations of our local, state, national, and international health experts. And so I really appreciate your time, and I still want to go with the WIAA recommendation.
That's what I was just gonna say is, when you guys can talk all this medical stuff back and forth, I don't understand all that, but I'm very uncomfortable going against the WIAA recommendations for our district when other districts are following them.
I had a couple questions that are non-medical, but our protocol for students right now, do they have to test negative to return back to class?
No, definitely not. And this is not a negative test either, just to be very clear.
It's just testing in general, then I guess. It's an evaluation, I apologize.
It's an evaluation for, sitting in class is not as physically exerting as being a student athlete, and so there's.
Well, related to that question is they do recess and they do physical education during the school day. So there is a possibility for that to occur then at the same time.
I would still contend that 20-minute outside recess is extremely different than a varsity athletic practice, so.
Agreed.
Okay.
Well, and right now too, the return to play protocol is actually a gradual bringing up the athlete back up to speed of where they were physically before, as far as their endurance and other things like that, extenuation.
Correct.
So that is something that's not going to change at all. That's not up for discussion right now. It's just simply the evaluation that we're discussing, correct?
To be honest, none of this was originally up for discussion until the board made it up for discussion, just to be very clear. So there is a recommended protocol from our local health providers, which is in alignment with all those other professional agencies that we talked about. And so I guess either the board is making something up themselves, or the board is agreeing to go with one of the other proven recommendations. I guess you could decide to come up with something in between, and we're gonna have to check with our liability insurance carrier, because I do not see our liability insurance carrier being okay with our school nurse or Dawn acting in a role. And I recognize what you're saying about parents, but being a student athlete is a choice, and parents already have to get a physical for their child to be an athlete. So it's not an everybody must, it's a, if you want to participate in these activities, then you must. And so
could I make another suggestion that might work? So does a person have to be in a medical setting to be evaluated if they do not need additional testing?
In your opinion, does somebody need to be in a medical setting in order to have that evaluation, in order for a provider to sign this form? Would it need to happen in a medical setting, or could that happen less formally, I believe is what's being asked?
Like, what do you mean? I'm just trying to understand what situation you would even do that.
So what I am willing to do as a nurse practitioner provider with the credentials to do the evaluation is I would be happy to spend one day a week up at the high school doing evaluations for athletes that are returned to play, needing that evaluation. Would there be anything wrong with that if I volunteered my time to do that?
I have to look at what school board volunteerism. I don't know that off the top of my head, I'm sorry. Because you're acting in your official medical capacity.
I'm not making any money.
And so to To be honest, that is, I hear your reoccurring theme that it's a medical or financial hardship. Have you had any athletes say to you, I want winter sports, but I can't afford a doctor's appointment? Because I don't understand
We
the.
offer really low-cost athletic physicals where I work, and we do have people coming in because they cannot afford to go elsewhere.
Would they come to you then just for?
Yeah, so why would
If
this be
if I
different?
use my own facility, I have to charge.
And so I'm saying, why wouldn't those same people who already use you continue to use you, and the people who already use the Chrome Clinic continue to use the Chrome Clinic, the people who use, that's what I'm saying, why would we make all of our students go through you as a professional?
The same reason you offer mental health services
Okay,
in the school.
You know, I think we're getting ahead and beyond what we're discussing. What we need to do, with even what you're saying, is to have a motion to rescind the previous motion, of the approval to change, of the change to return to play. So at our last meeting, we had a motion and it passed by 5-2. So I make a motion to rescind the previous motion of the approval to change to return to play. And so we can take away what we did at the last meeting by that, to rescind that motion.
I would second that.
Okay. Okay, now we're up for more discussion on it. We have.
Can we see the form that we voted on last week by chance? Is that possible to see that form?
Sure.
Or not last
Sure.
week, I apologize, last meeting,
Yeah.
I apologize.
It was included in the packet,
Yes.
under the WIA
I
packet,
can
but
see it on
yes.
the board here.
Yep.
My phone won't load it.
So I have a question. I'm obviously not a medical person and I don't play one on TV, so what are the signs? What would the eval reveal to lead somebody to recommend further testing? Because they're concerned about myocarditis.
Dr. Forstein's ready to answer.
So, there's a whole algorithm that we use to, here I'll show you. You can also find this on the WIA website. So it's in part based on what types of symptoms a given student had. I don't know if you have access to that or not. So it's based on severity of symptoms, length of symptoms, and also the intensity of the sport that the student will be going back to. And so any student who's had moderate or severe illness, and that would be, moderate would be fever for more than 3 days, they've been bedridden, they've been fairly ill, they're recommended to have an EKG at a minimum. And if they've had severe illness, really bad lab abnormalities, they've been hospitalized, they actually had cardiac abnormalities and needed cardiac testing while in the hospital, those students need to be evaluated by a pediatric cardiologist. And potentially even have things like an echocardiogram, which is a heart ultrasound, a stress test to make sure that they can tolerate physical activity without having EKG changes. And so I have a couple of more thoughts. You know, we don't argue about whether or not kids who've had concussions would have evaluation before returning to play. I think that's akin to what's going on right now. You know, why are we looking into this? Well, there's a small chance that a kid's going to have a re-injury with a concussion, and we know that. And so we look at them and we put them through a return to play protocol. So there's a small chance that a kid's going to get a myocarditis. Okay. I mean, I'm not willing to let it be my kid who drops dead from sudden cardiac death. Part of the protocol in this article and from all of these medical societies is that you have an emergency action plan in place, meaning you have an AED on hand. So if your athlete has sudden cardiac death, you can bring them back to life. Think about that.
Any other comments or questions? Discussion?
Look at the form,
Troy.
that's possible.
Oh, yeah,
I
it
added that.
was.
Yeah, having,
Go ahead, Mr. Rogers.
Please go ahead, Dr. Rogers.
I would add that the idea of having a medical evaluation outside of a clinical setting, whether it's the Chrome Clinic or Footprints or Ho-Chunk or anywhere else, opens the door that if you feel after an evaluation that the athlete needs additional testing, now you've got to bring them in for a second visit, and the likelihood of the athlete potentially following through or falling through their cracks, I think, is greater. And I think as a provider, there's the slightly higher chance that you may be more willing to let someone go through without having those accommodations on hand. So I don't think that's the best, and personally I don't care where they're evaluated, which clinic. I just think most parents are gonna wanna take their kids to their provider, wherever they are, if they're concerned enough.
Well, they won't have a choice, they have to go someplace. So, and if they don't return for the testing, they don't get to play. So I'm not sure that that would really be an issue.
Okay, now, Troy asked to look at the.
I equate that, like, with concussions. We don't let our athletes go back before they have, an impact test or further evaluation with the provider, so I would say this is as paramount, if not more.
So,
And again, to go outside those WIA recommendations, these are people far smarter than anybody in this room who came up with all the data and even looked at the data that you're talking about, Patty, and said, no, this is what should be done. And so if you're gonna say, no, we don't think we should do it that way, we're gonna just strongly recommend it to parents, but if they say no, we're gonna let those kids go back out there. The first kid that has an issue, I honestly don't think you have a medical legal leg to stand on, and I think that should be as big of a point in our minds as just the concern for the athlete.
Troy had requested to look at the form, so we'll pull that back up again.
On the bottom of the form, that's where the provider signs off.
Mm-hmm.
If we look back at the meeting notes, did we not just cross off that section and left the rest of it in place? Is that what we did?
Yep.
Okay, I just wanna make sure that we're all on the same page there.
Yep. And so, without that,
Yes,
we're giving every parent the opportunity to do that, or we're asking Dawn to do that, or we're asking our school nurse to do that. Or each kid gets to decide whether they've met all those other criteria.
because it does have, discuss return to play and some of the conditions of what's state on the very bottom of that. That's under the new form actually has this part in there. The self-evaluation part, just call that, I guess. There's a little bit of that to it. So my question is, I guess, if we eliminate the provider part of it, the responsibility then falls on the school district then? Because if, this is non-medical again, if they have another medical condition that's not concussion or otherwise guy has a policy about it, is the school district liable for that? If they had a car accident or they have an injury from prior and then they have and then that exposes itself again while they're doing sports,
So
it's a liability question, I guess I have.
Yep.
So.
And so partially, I'm gonna ask Dawn, and I think.
Yeah, so we ask every athlete to have a physical, obviously, to participate, and if there's ever a concern about, like, we've had some pretty heated issues in the past where athletes have had major injuries and they have wanted to return to sport with those injuries, and there's been some pretty heated things have gone on in the past, and we have not been willing to take on that liability if there has been known that I evaluated someone and I've said, no, I'm not going to clear them. I know they are at a significant risk for future injuries. I won't take that on liability. And the physicians have backed me and they've said the same thing. We're not taking that either. And the school has backed that. So if there are situations we could be unaware of, sure. But the situations we've been aware of, we have always asked athletes to go back and get physician clearance if there's been a major concern.
To be honest, it's the same as an employee who has an injury or is out for X number of days. We make them get a medical opinion because that is not our expertise nor ours to gamble with in our opinion. So that is very common practice that if we are aware of something, we make them be medically cleared before they can return.
My whole question again is we are requiring asymptomatic individuals to do that. And if we're truly concerned about myocarditis, then we need to push that date out to 2 to 4 weeks after they start having symptoms rather than 10 days.
And that wasn't at all what you discussed at the last meeting. And so
Can I interrupt that it is 2 weeks is the minimum, and it'd be 21 days before they return to participation based on the numbers.
Again, the risk is from 2 to 4 weeks. So if you want to be
We're
absolutely safe and
we're
without
getting
risk.
beyond the conversation of there's a motion on the floor and a second to rescind our previous motion to approve the changes. And so we're getting beyond that conversation. So I'd just like to address any more questions about that you have about the action we took. I am kind of concerned that, you know, we have the WIAA coming out now with their recommendation being the same. Does that affect, Jay, our competition and ability to compete in WIAA sports? if we're not following that recommendation.
Jay, I don't know if you heard, she was asking if we would be in jeopardy of competing in WIAA sports without following their established protocol.
I'd have to look at this. Normally you have to follow their protocols. I don't know if this is a guideline or a protocol that they've set out. I have to look at that more closely.
Yeah, it is my understanding that WIAA is recommending this very, very strongly, and it would be looked at as a requirement, and a concern with other schools that are playing against us as well. And again, I repeat, I do not think our school board, I think it's an irresponsible decision to go against the recommendations of the experts and to participate. I just don't know why.
And so process-wise, just so everyone is clear what needs to happen, if we're going to do anything different than last meeting, we have a motion and a second on the table, action would need to be taken on that. That would erase it and we have nothing in place. So then the board would need to decide what we were going to put in place. Or we're gonna say we might as well cancel winter athletics because we have no protocol for athletes to return to play.
Okay,
I'll
so,
call the question.
okay, the motion is to rescind the previous motion and approval of the changes to return to play. And again, we'll go with a roll call vote, and I'm going to ask Marty to read that off.
Mary Jo Rasmanowski,
Yes, rescind.
Mary Jo Radcliffe,
Yes.
Troy Webb,
No.
Amy Huffman,
Yes.
that was yes. Sorry. Ann Deemer,
Yes.
Patty Jacobson,
I would say yes, I think we should redo it. And that opens the way to redo it.
Okay, motion carried. I'm going to just open up and make a motion to approve the WIAA return to play recommendation as presented.
I would second that. I'm sorry.
And now we're open for debate or discussion and questions. Okay, a motion has been made and seconded, and now we'll have debate on and discussion on the
Mary Jo, I'm sorry, what was the motion, said they
The motion to approve the WIA return to play recommendation.
Okay, thank you.
Any,
So that usurps then what we, basically that will usurp what was presented at the last meeting then. The new WII will be exactly what we use as a recommendation, and we're gonna take it and use it as for our school district to return to play. Okay.
yes.
That's what we're discussing. I just wanna make sure we're voting on the same thing. Okay.
Yep, that's what I was recommending.
Okay, thank you.
I again have concerns about the timing. I also have concerns about access. And I know if I call anywhere to try to get an appointment, it's 2 to 3 weeks. And that's why I made the offer that I did. I feel like I'm a competent practitioner. The medical people up there can decide if I am or not. But I feel like I could do that. I would be happy to volunteer my time to do that. A person still would not be allowed to play if they did not follow the protocols and do the testing that was necessary. I don't know that it would require an additional appointment at another facility to do an EKG. Oftentimes tests can be ordered at facilities by any provider as long as the provider has credentials.
I guess we're getting into some details
So
that.
can I just ask for clarification? Are you suggesting that all athletes must use your free volunteer
Nope,
service?
they can go wherever they want. I'm just volunteering that there would be an expedient way and an inexpensive way for people to get that done.
Can I do one thing? I honestly don't think access is an issue because I communicate very closely with all of our athletes on their injuries. And once they have a positive test, it's 14 days before they would even do the medical evaluation. So they have if I communicate with them, they have a 2-week heads up to get an appointment scheduled for this day. So I really would find it hard to believe that in that time frame, with that heads up, they wouldn't be able to get an appointment.
So can't they use the on-call doctor too? And get one that day?
Yeah, I believe so.
Yes.
I believe that Black River Hospital Clinic is also taking same-day appointments. I can't speak for the Ho Chunk Clinic, and I can't speak for Footprints in Time either, but I can tell you that if there is an issue like this, all of us make an effort. If it were a concussion or if it's post-COVID reevaluation, we all make an effort to see our own patients, and if that's not a doable thing, then the physician on call would see that athlete.
Okay, any more questions or discussion? Okay, there's a motion and a second to approve the WIAA return to play recommendation. Okay, we'll do a roll call vote on this as well. Marty?
Mary Jo Raspinowski,
Yes.
Mary Jo Radcliffe,
Yes.
Amy Huffman,
Yes.
Troy Webb,
Yes.
Ann Deemer,
Yes.
Patty Jacobson.
No.
Okay, motion carried. Thank you. Thank you, everyone, for joining us and providing us with your expertise.
Thank you very much for your time tonight. We appreciate your help supporting the original protocol and then coming back to help us understand the medical conversation that just happened above most of our heads. So thank you so much.
Thank you.
Thanks, Brett.
Okay, now,
Thank you, Don.
we had jumped ahead there to accommodate our guests there. We're going back to 7.2, employment recommendations. And we have a retirement, I hear, that this long-term person.
Leonard Olson, right? I can't find the
Yeah.
case, but I'm pretty sure, yes.
Yeah, he's been here forever.
44 years.
44 years, yeah.
Does he hold the record?
Him and the Vanderpauls, I think.
Yeah.
Mm-hmm. So Leonard Olson is retiring. He's done now, or he's got a week in, a little bit in January, I think? A little bit in January, so yes. He's been our building and grounds for over 40 years that he has done that work. And so he was hoping that maybe he wouldn't have to do a lot of plowing before that retirement, but
Looking
we'll
good
see.
so far.
Yeah, that's right. We'll see if Mother Nature continues to agree.
Okay, is there a motion to approve his retirement?
I'll make that motion.
Thank you.
Seconded.
Thank you. All in favor, say aye.
Aye.
Opposed? Okay. Next on the agenda is,
Trying to get in.
It restarted.
Okay, I was just like, I don't know if you know that you're frozen on nothing. Okay.
Yeah.
Okay.
the next item, WASB Delegate Assembly Representative, that is taking place during the convention, and there have been 2 people interested in serving in that role. Is there any, one is Mary Jo Radcliffe and one is Patty Jacobson. Anyone else interested in doing that for this year? I will have a vote and be there representing Region 6. I could also vote if we didn't have someone, but I was glad that we had Mary Jo and Patty step forward.
We've both done it, haven't we, Patty?
Yeah, we have.
So if there's someone that hasn't done it, that would like to do it?
Amy, you have done it.
I've done it before, but I don't think I would enjoy the experience at all trying to do it online.
Okay.
I don't think anybody's going to do
No.
that.
I believe it will be
I found it hard to
shorter.
participate in a regular meeting that way, and this is a lot more involved.
And we can also come here to use the internet here, if we would like to.
It's not an internet issue, I've got a good internet, but it doesn't, it still freezes up periodically as
Oh, really?
you know.
Because I have
Or if it's
no
a latest
issue
one.
with the WASB meetings at all, that what I've done with them.
I find it hard to hear the conversation well,
Okay.
so no, I personally don't want to do that.
Okay. No, Patty, you did it last year. It's been quite a while for Mary Jo. I guess
It's been a
I
while. At least I won't get yelled at for watching without taking on my tape.
They'll say, turn your camera back on. So,
Okay, and Ann and Troy, you know, glad to talk to you about that in the future. I know you're kind of new to the whole thing as well as WASB, but you know, I encourage any of you to do that.
It is interesting.
Okay, since it's been a few years, I'm gonna make a motion to recommend Mary Jo Radcliffe.
That's fine, I don't care.
Okay.
That's fine with me.
But either way.
Okay, so then we just need a second. Is there a second for Mary Jo Radcliffe to be a representative? Patty seconds. All in favor say aye.
Aye.
Opposed. Okay, and then Marty, you will take care of communicating that down?
I will.
Okay,
Yeah,
thank
I'll do
you,
that tomorrow.
thank you. Pandemic leave.
So you found in your packet, or attempts at an addition to our employee handbook. If you recall, this fall, we shared with you a one-page document that had several COVID-related handbook changes that was shared with all staff. The FFCRA, Families First Coronavirus Relief Act leave that was established and then was extended until December 31st. We had been told up until Friday that there was not a chance that that was going to be extended. There was no conversation about it possibly being extended, and so that left a lot of districts with what are we going to do. Jill's professional organization did a great survey of our region, and almost everybody was looking to extend the leave. Some people were adding a brand new 10 days on to everybody. You noted in our policy that is not what we were suggesting, and so we were suggesting that we would extend the timeline past December 31st. Then Sunday, a stimulus bill was passed, and we were notified today by Bob Butler from WASB that he believes there is an extension to the FFCRA included in that, but he linked a blog post where he had read something about it. He said the document is so huge he did not have the details yet at that time. And so what I guess we are recommending to you is that we approve this leave, this extension, so that we know starting in January we have something. However, if and when the federal leave comes out and it is an extension that trumps our local policy, because we don't have that language for you to react to, and before you come together again, we're going to have staff back who are going to be in that spot, unsure of whether they qualify for COVID leave or not. We would like them to go into break fully confident that they would have that flexibility of those 10 days. And so what we are saying is if we could approve this policy with your approval, obviously, and then once the federal leave becomes known, we would defer to the federal leave as opposed to our local policy. Does that make sense, what we're asking for? All right. Again, Friday, we were told, no way, no how. Then Monday, hey, we think that there's something included in there. So it was interesting to know of our 280-ish staff members that we had, Jill, will you help me with the numbers again? 102 staff members who have accessed that leave, and so just under half, but not all 102 of those people have exhausted the full 10 days. There certainly are some who, far fewer who have exhausted all 10 days. There's far more who have taken it in smaller amounts. I will tell you that our teaching staff overwhelmingly has been able to teach from home. For some of our non-licensed staff, it's more difficult for them to do their work from home, like our bus drivers, our cooks, some of our instructional aides. Some are able to do work from home, but the teachers overwhelmingly have been able to work from home. So, questions or comments, concerns about that?
I make a motion to approve the new pandemic leave language.
Awesome.
And can I just add for clarification, until the federal leave becomes?
Until the federal leave
Okay.
becomes.
If and when to be replaced by federal leave if passed.
Sure.
Thank you.
So I did have one question, which I think was answered in here, but if they are able to teach during that quarantine period, then they would be working.
Correct, and not taking leave.
Yes.
Yep, absolutely,
Okay.
absolutely. And I think that that's why we have such a small number that have exhausted all 10 days.
Right.
We've had some teachers who, they're out for the 10 days because they're ill themselves, and some of them have taught for 7 of those days when they've been quite ill, and then they would not be able to for a couple days because they're extremely ill. I mean, the teachers have moved heaven and earth to try to teach from home because either way they have to prepare the materials for a sub. So it's like, okay, I could prepare all this stuff in greater detail to have somebody else do it for me, or it's that age-old adage where a teacher says it's more work to be gone than it is to be there, and so they teach from home unless they truly are too ill that they've been able to do that. So
I just was making sure I understood that correctly.
And so there was a teacher, we asked them, are you working from home? They said, well, I prepared all my materials, but someone else is delivering them. Oh, then that's a sub. You haven't worked from home, but we get you are literally working while you are home. So.
Any more discussion or questions? We have a motion and a second to approve the pandemic leave until the federal takes place. All in favor say aye. Aye. Opposed? Okay, motion carried. Next is, new course, proposals, and you received that information in your packet. Stephanie's gonna give us a brief overview.
So I know it was a long packet of stuff, and so hopefully you were able to take a look at those 3 courses, all in the CTE areas. So just hats off to that group of teachers, because teaching in the career technology education field this year in the with the COVID challenges is already a lot on their plates, but yet they are proposing 3 new courses to keep challenging students, so that's fantastic. So Mechatronics in the area of tech ed with the wonderful Vex robots from Ashley, approved that last month, and then sports and entertainment marketing and entrepreneurship marketing in the business area. And so I don't want to repeat what was already in there, but all 3 of those courses would be some upper level offerings, kind of a deeper dive into both of those fields with some prerequisite classes. And so I don't know if you caught Mechatronics. We had an amended version of that course proposal that came in on Friday after these teachers submitted it to me. They had some additional PLC conversations and wanted to add an additional prerequisite to that course. The course itself is going to remain the same, but they're looking to transcript the prerequisite electronics and robotics. That's a class we already have on the books, and then possibly transcript this one as well as was in the notes. And so just a few changes to the original course proposal, but Marty did add it to the Moodle on Friday. So do you have any questions, I guess, about the courses?
I just had one about the entrepreneurship one.
Yeah.
The other one, sports and entertainment, that was every other year, so it wasn't a staffing issue. Is there a staffing issue at all with that entrepreneurship one?
Good question. So that's a class where we're teaching it now with marketing. We have several sections of marketing. And then the marketing class that happens to line up with the entrepreneurship production on the tech ed side. I suppose I should be talking to this, sorry. That one section where it happens to be now, they align, and so it wouldn't be adding more sections. It would just be being more intentional about having kids that want to have that partnership sign up for that particular marketing class, as opposed to being lucky enough to be in that one. And so it shouldn't be an addition of staffing, just more specific choice for students, I guess.
But when it comes to staffing, that really is a very valid question, and we've talked about the fact that sometimes courses get approved, but they're not necessarily offered right away. And so we still do, in some portion, the students vote with their feet in what classes are offered when by, the courses that they sign up for. Those are the sections that we can offer. And it is very true that sometimes there are courses on the books that don't get offered because they get small numbers. And so we try to create some kind of an every other year so that a student could plot their course through high school, but that doesn't always work out that way. So.
Right, an example of that would be statistics. You approved that course last year here, and then with all of the staffing in the math department, there actually was a fair amount of students that wanted to take it, but it was a challenge with so many new math teachers coming in, so we decided to wait and offer that one this next school year. And so that's a good example of that.
Thank you. Any questions? Do we need action to approve that or not approve? Is there a motion to approve the new course proposals?
I'll vote to approve those new course proposals.
Second. Any more questions or discussion? Thank you, Stephanie, for doing that. All in favor say aye. Aye. Opposed? Okay, motion carried.
Thank
You
you
can
very
just
much.
stay right there, I guess.
I can, because I'm next with the
update.
curriculum director report. So I just pulled together some quick updates for you. The first one, just wanted to share with you, we've talked a couple times at the board level about our need for continued support in reading foundational skills for students. We've approved additional resources in that area. And so we also have recognized the need to build our teacher toolboxes around teaching foundational skills. And so Orton Gillingham training is some of the best out there when it comes to reading foundational skills. And so we decided to allocate some Title I funding. We're school-wide programs at the elementary level, and so we can use those funds for training as well. And so we were able to send 7 teachers so far this year, and the spots went like wildfire. And we had so many teachers that were on the waiting list that we also were able to get approval through our Title VI grant as well to allocate 7 additional spots that were all snatched up right away. And we've got about 13 people on the waiting list for summer as well. And so the nice part with this training You can see it there, they have all kinds of offerings on weekends and at night and a wide variety of things. It is intensive, it's 30 hours of training that teachers engage in. But the beautiful part that really is why we decided to invest in it, even though there is definitely a cost to it, but it is that multisensory approach to the early levels of reading, and we know that that is highly effective for our particular population and for a variety of reasons. And so we've been super excited that people, especially in a year like this, have decided to engage in this intensive training. So very exciting. Just wanted to share that with you all. Any questions? All right, so the next piece to share, we had a couple of teachers that recently received notification that they are nationally board certified. Christy Rausch, 5th grade teacher and instructional coach at Red Creek, and Vicki Kramer, who is our reading specialist for the district, went through that couple-year process. National board certification is one of the highest honors you can receive in education. So I know I attached this article that we had on Facebook and in the paper as well in your packet. So wonderful to celebrate that with them.
So later on, Laura Simonson's gonna come in for the Red Creek update, and she's gonna talk about that again. And they had cake and punch today, so we're all gonna clap, clap, clap again, because that's what, no, I'm kidding. It is an amazing accomplishment, truly. Those two ladies have just done a phenomenal amount of work, and the great news is that they're both ready to mentor some other people through that process. So
do we have other people doing the process right now?
Not right now, but there's a couple that they're both convinced that they've got at least somebody ready to.
Interested possibly. So
yeah.
It's kind of neat because Megan Finch had gotten it previously, and she was kind of the same way, like, ooh, I want to bring somebody through this, and so she was a wonderful resource and mentor as they were going through their couple-year program. So it's fun to see it grow. And it just so happens that of our instructional coaches, 4 of them are national board certified. So that's really wonderful when you think about the leverage that provides for teachers and how we continue to grow people, that's wonderful. Just really quickly wanted to share with all of you middle school science. They are going to start reviewing materials. So we, several years ago, adopted a resource that is in its last year of the contract we purchased with them for digital resources and a workbook. And so we are in a little bit of a quandary because we have leaned heavily on the research of ed reports. And so if you had looked at this prior, there is one of the resources on this list of, I think, 13 or 11 that's green, and the rest of them are yellow or red. So we were kind of waiting. They've known all year that they need to start the review process, but there was a lot on the site. You can go to resources that are currently being reviewed. There's a lot of science resources that were under research, and so we were kind of waiting to see if we had additional options coming out that were better aligned to the standards, and so as well as having some good coherence and scope. And but we are, nevertheless, we're still gonna get started. We have some samples of the 2 higher rated ones, and we're gonna kind of see what options we might have. So our current resource is called Interactive Science. It has been updated to this Elevate. The middle school version has not come out yet, but this is the elementary version of that same title. And unfortunately, we're really waiting to see what that one was like, just because it'd be nice to not change. But we recognize some holes in it ourselves. So it's unfortunate to see the elementary results come out. So we're still kind of waiting to see what happens with middle school, but we're at least going to start some of those conversations after the break. So just wanted to update you on that. Eventually, we would likely be bringing some resource adoption for approval, but we'll keep you in the loop. And the last piece, I just wanted to share with you every so often. I share with you kind of some of the opportunities that the high school provides and the electives for students. And so last year, I think we kind of shared at the retired teachers breakfast, and we didn't have that this year with all of our COVID stuff. And so I just wanted to share with you our current reality of transcripted courses. When a class is decided to be transcripted, that's not something that the board takes action on, like a new course proposal. You have approved courses that are going to be transcripted, so then you hear about it, but not necessarily in its whole package. So just wanted to share. Last year, we added several courses that were transcripted that are highlighted there. And so that's just exciting that teachers keep doing that work, because every single year they have to go to the college that they're transcripted with for a full day in the summer to rework their curriculum with the professors within that department and make sure it's at the most cutting edge level, and that's very rigorous. And so we really appreciate them being committed to that so that our students can gain those credits, as well as just the rigorous experience in those classes too. So lots of wide variety of classes there on that
And
list.
such just because we have new board members, since we've had this conversation, would you talk just briefly, what does transcripted credits mean for them?
Absolutely, sorry about that.
Okay.
So transcription is a process where we take our curriculum and we align it to the college level curriculum through a technical college. It's not a process that is in place with the university system, but it is in place with the technical college system. And so by earning a B or better in the class, students are able to earn then 3 credits. And the technical college system has agreements with the university system, UW system, for accepting some of those transcripted credits, sometimes in the very same content area, sometimes just accepted as an elective credit towards their credits that have to be accrued for a degree. But it's a wonderful way for students to experience a college level class and to kind of see themselves reflected in a college class, like, hey, I can take a class like this and do well. That kind of gives them that vote of confidence that I could take college classes and do well, whether it's technical or university system, as well as it also gives them that leg up in having credits when they leave us to be that much further along towards getting post-secondary credit as well. So sometimes it helps them explore some pathways that, gosh, I've already got 3 classes in this pathway at technical college. It wouldn't be that much more for me to get a degree, a 2-year degree, or even a 1-year degree in that program. So it's got a lot of great benefits for students for sure, and it's free, which is better for everybody as well. So
the last 2 years, we've started recognizing our graduates with those extra colored stoles, or cords, pardon me, if they have already acquired some college or post-secondary credits before graduating high school. And so it is absolutely free, but it is not something we make teachers do. We have such an incredible variety of offerings because teachers are motivated to do that for their students. And I'm certain it increases the student interest in some of those classes as well to graduate with those credits.
For sure, and for a district our size, I have it listed there in our CISA area. We are one of the top 3 districts, and remember we have big people in our district, Pullman and La Crosse and Onalaska, that are so much closer to those institutions, those larger level institutions. That's pretty wonderful on behalf of the educators in our district. One of the ones that they added last year, the personal finance, that is a way to get that graduation requirement, our financial literacy graduation requirement. A lot of students take personal finance, and so to take that for graduation and then also walk away with 3 college credits is pretty great. So they aligned it to the 3 classes that Western offers: the personal insurance, the personal investing, and the personal money management. So that was exciting as well. And then the rest of that document just goes through to remind or share some of the additional elective opportunities we have for students to help them grow towards post-secondary education, towards different pathways of industry or different employment opportunities. So, any questions? All right, I know we have a couple of teachers that are thinking of transcripting additional classes, so hopefully we'll go from 16, just from TLC conversations that I've been part of. I think we might be close to 20 for the 21-22 school year, but we'll see how if they're able to make all that happen. So, all right, thank you so much for your time.
Thanks for the update. Policy committee report. We have 1 policy for the first reading.
You jumped over the expenditures. And
I'm sorry. Oh, I had it
we
circled.
can jump if you want, but
no, I'm sorry. I'm sorry.
No, that's all right.
Okay. You received the monthly expenditures under finance and facilities in your packet. Does anyone have any questions or anything to pull out for clarification? Hearing none, is there a motion to approve?
I move to approve the monthly expenditures.
Thank you.
I'll second it.
Thank you. All in favor say aye.
Aye.
Aye. Opposed? Motion carried. We'll go to facilities update. I don't know why I don't know why I circled that.
So I dropped some documents in there. They probably were not on the Moodle. I just got them today. Yep, it was just, can you zoom out just a little bit, right? The lower level. Can you keep scrolling? Where's the, there we go. There's the top floor. Okay. So just so you know where we are at in the process, we have met with the teams of teachers for these spaces, some of them twice, all of them at least once. And everything right now is still very, 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 very early drawings. And so it's we have a conversation and they listen, the architect and the construction company, they listen, and then they go back and they make some edits and they come back to the group again, and it's just this constant back and forth for a while. So what you're looking at right here is the current 4th Street School, and All of this color is the current, and then the yellow is all the new. So this is Forest Street right up on top, so you can orient yourself as to where things are going. What you are seeing is the secure entryway and the office, along with health room and space for Para's workstation, and all of that office equipment storage stuff would all be in that area. And then we know that we need to add a few classrooms onto that space, and so these two spaces would right now jut out kind of where the courtyard is, and so they've been talking about how tall of a retaining or wall we might need there because it's where the ground starts to go down. You'll notice that there's some small group instruction spaces, just like we're a very high priority over at Red Creek Elementary School, and they are used throughout the day. There was some conversation about taking that classroom up above and making that kind of a large group gathering space, but instead we decided this, because right now the building is kind of awkward. You go from the office around and then you have to go all the way back. This is going to make the flow go all the way around, and so this connection space here, this yellow, will serve as kind of that commons area to connect to the old office area. So when you look at Red Creek, each one of the pods has that space between where their classrooms all go around the outside edge, and then there's that common space in the middle. At Red Creek, you often see small groups of kids out there working together, or another adult, whether it's a volunteer or an aide or somebody else working with a student out there. There's certainly, it would be great to have a space like that at Forest Street. However, because the kids are so much younger, they don't go out there independently. Usually if there's a kid wandering around, there's an adult pretty close by at Forest Street. They don't work as independently individually. But that would still allow some space if two classrooms wanted to group together and do some activities, larger group, all of that stuff would still be possible. Coming right off of, so this is the current gymnasium kitchen area. They're talking about inside a large stairwell that would take you downstairs into that new cafeteria area. And that would be a nice, like a story and a half, kind of like the high school commons is, that you walk in, you see all that natural light there. That would be that spot there. So this is the current office area that is likely to become a kind of a special education suite. At Forest Street right now, there is not a bathroom that is large enough for a Hoyer lift to be installed, and so the kids are smaller, so they physically move the students when they need diapering and stuff, but we think it's best practice to get that out of the classrooms wherever we can and find bathrooms that are large enough to accommodate all of that. We were in a situation where we had to, in a classroom, kids could be over there and a curtain was pulled and a student would be changed, and that just doesn't feel as respectful to anybody if you can make a bathroom space. So this is the current office, currently Melanie, and then the conference room, and then this is their sick room and restroom. Last meeting we talked about making this whole thing the ADA bathroom that could have the Hoyer lift and all of that right up in there for everyone to use. This is the upper part of the stage, so when you're down below, there's the Forest Street gym and then the stage area that's open all the way up. That building has such an incredible need for storage. We're going to put a ceiling on the stage or a floor up above, however you want to talk about it, but we're going to make that 2 layers there so that from that upper level, there can be a large storage area for that building because there's just so much stuff that doesn't have a space. So I'm going to go down to the lower floor.
I have a question on the upper floor. The pink is what you're changing this existing structure.
Correct.
You're adding a bathroom and taking a classroom out, I think you're asking? It'd be on the east wall, I guess.
Oh, in here?
No,
up above, and then scroll down.
And then go to the,
Yep.
I guess the right of the picture.
I'm just laughing because they always use cardinal directions in those meetings. I'm like, could you tell me right or left, or put an N somewhere, help a girl out here, please. So there is already a bathroom down on the end there. So that space, it's just really weird shaped right now, and it's very small. So the way it's built, here's the hallway, and there's no way to get in it. You have to come in and around, and so it just takes up space. And so they're reconfiguring it so that you can enter from the hallway. So there's already a restroom that would be replaced with a restroom that can accommodate more people there.
Yep. So I have a question.
Yeah.
With the new stuff that they're proposing, how, there's, right now there's stairs there and a hill. How much overlap is that? Like, what are they proposing to happen to that?
I'm concerned about the grading at that site an awful lot, so we're waiting for the, civil engineers to come and take a look at all that and see what possibilities exist. And so, like, the parking area that we just got all families trained where the buses go and not families, all of that stuff, we are hoping to not have to untrain anybody who already knows how to use all of that. So it's going to get close when you see how far that comes out. But they're gonna dig into that side. So we have those stairs that have all that great big rock around them. That is likely to be dug out, and that will be the cafeteria will be the underneath, and then the office will be up above that.
Okay. And in the courtyard, you're talking about, or they're proposing building a wall as opposed to filling it in and having.
We talked about that a little bit, and just because of the grade in there, you can still get underneath. So there's stairs. Do you want to show them where the stairs currently are? Like
the outside stairs are right here.
And those are gonna go away, and that's just gonna be a grassy hill then.
And we have outside stairs here.
Which will stay, because we still need kids to be able to get down, so if they come out any of those classrooms, they come down, go underneath and out to the playground. So, we think that is gonna be one tall wall for the exterior of those classrooms, as opposed to filling the whole thing in, which would then,
Plus emergency exit, you lose your emergency exit if you have to fill it in.
because you'd be stuck in the courtyard, now you can get out the
Get
bottom.
away from the building.
Okay, next. Okay, and so then this is the actual cafeteria, and you can see the kitchen and receiving. If you remember from our tours, the kitchen at 4th Street is extremely small. They don't have enough storage space, and so it's actually throughout the building you find kitchen storage stuff. And so the separate receiving area, kitchen, and then the cafeteria, and it's just so funny when you start talking furniture on there, because all the 4th Street people were like, couldn't we have long tables? Do you know how many milk cartons I open every day? Whereas you get to the upper levels, like, can't we have small round tables so kids can spread out a little bit? But everybody knows their space and what is gonna work best for them. And so that is the proposed kitchen. In between there, we're adding some restrooms, because for code, if we're adding that cafeteria, we'll need additional restrooms in that area. That would also be served from the gymnasium. You see another storage. Remember that Black River Area Child Care Center uses that gym after school time, and they right now have a ton of stuff underneath the stage. So stage sits here, and there's these sliders underneath. It is filled with BRAC stuff. They're gonna need somewhere to put that stuff, because we're flattening the stage level, and so part of that storage room would likely be used for them. And then this is already some storage that exists on that side, and then that is the stage that we are proposing gets lowered to the main floor level and have like double door access to the main gym, but still be a separate space, because very often there is somebody in that special ed adaptive gymnasium space. That is where an awful lot of the self-soothing things are, the large motor activities, as well as adaptive FIA takes place in there, and sometimes OTPT goes in there. And then the speech and language OTPT, those two pink spaces you see there, those are the current locker rooms. And so they were so excited to not have a shower in their space anymore. And OTPT definitely needs a little bit more space, because she does some of the larger motor things in there. And then speech and language is more table work together, and then could still also get a PE office, whereas right now speech and language shares an office with PE. So those are proposed changes. And there's not, that building has hardly any staff restrooms, and so staff are just used to not having privacy. But they did say, you know, the 3-year-old is constantly climbing underneath while you're in there. It sure would be nice to have a little bit of privacy. And so that bathroom is being added on that main floor, or on that lower level for adult restroom. Any questions about 4th Street? We were just scheduling some meetings for the first week back in January, where the staff will take a look at these next round and give us some feedback. So this is the current high school. This is without any changes. You can see the west gym down here, Sam Young in the middle, and the LMC down on that end to try to orient yourselves. So here is the proposal. We'll start down in the basement with what is likely to be our first piece of the project, is the boiler. So the good news that we got last time is that because we are not proposing putting the boiler back in the exact same spot as the current one, that it is possible that at first they were very concerned that we would have enough time in the summer to get that project done. And Jill and Kent were saying that we got Bessie fired up this year, but we're not sure she's got another year in her, and so we were glad to hear that it is possible for them to start prepping this other room. If you remember when we went, there was those stairs that you went down into when you're in the boiler room, but then up in that hallway down in the end, there was a larger space that was not really being used for much, and so that would become the actual boiler room where it is pink there, and that actually works well for some of the ducting that they were talking about with where it aligns up above in some storage areas as opposed to the middle of some classrooms. So right now our plan for the summer of 21, the boiler is really the only piece that we are thinking is going to happen for the summer of 21. And the one part we didn't talk about forestry was what temporary staging will look like for next year. We've started talking to the building about what ideas do they have, because when you look at where all that new construction is, it's going to be very difficult to gain access to the building. And so we're talking about if we could make a temporary office somewhere else, or do the office be connected to the rest of the building and we need to put a trailer somewhere for a classroom to move into for the year, just what all of that is going to look like. And so that will be our work for the coming weeks to make sure we have a solid plan for how all that will happen. Back to the high school then, so you can see our music area finally taking some shape, which is super exciting. And so this becomes self-explanatory, but the band area, this is a large band uniform storage area. If you've been in the music rooms currently, the practice rooms are just jammed full of all of that stuff that deserves better storage than that. And so the way they have it configured is that the band director and choir director would have offices kind of adjoining right here, and then there would be a suite of practice rooms that would serve both of those areas. And then I thought this was a neat idea, kind of a larger ensemble practice room, so that it's not the full band or the full choir, but maybe it's a saxophone quartet, or maybe it's a triple trio or something like that. There's a separate ensemble room with windows on both sides so that they can be viewed throughout, and then the choir room would be right here. In addition, this whole space right here is music library storage. So our music people wrote a grant several years ago for those really nice Wenger music storage sliding shelf things. And so that library is going to house those units that they have already received by a grant, and we would add to it because there is just such a lack of storage in that music department in general. So right now we're discussing the band would have the music or instrument storage actually out in the hallway. Right here would be instrument storage, so that if a student forgot their instrument, they could gain access to the building. They'd be able to just go and grab it out of their little locked locker without needing the teacher to be there to get into the classroom. They could also return them after pep band and put their stuff in there and so forth.
Yeah. Altitude changes in the
Yeah, so they said that they don't build those as often as they used to. Like you go to our middle school and both the band and the choir room have the tiers, and they said that they don't build those as often because people find them very limiting. And so in the band, not so much, but in the choir side, they talked about some nice portable risers that would be set up like most of the time, like some portable but more permanent, I guess. And so then the choir area there, as you can see, along with storage in the end or on the side there, and close access to that music library storage as well. The very end classroom is for art, and so you can see that there's a whole bunch of pottery stations that are added. There is one change that we are suggesting for this area is to move perhaps some of the storage to outside of the classroom so that they have a little bit more legroom, because there's not a lot of space for all of the storage and drying of their projects that are en route, right? So when they have 5 sections of classes creating things, they need some space to store the projects halfway through. So, but a separate kiln room, and she was pretty excited at those possibilities. So you can just imagine the beautiful windows that would be on this side. And the band and choir were both like, you mean we could see the outside world from our practice area?
The question I have that I guess, sorry to interrupt.
No.
Outside access to the parking lot, we'll have to pass through those sections then?
So you can see the doors up on that end and down on the other.
Because the existing door is pretty, it terminates in a pretty wide hallway. I was curious how you're going to funnel, the students funneling through that to go to the parking lot, the new parking lot that's going to be installed.
So right here, currently there are the 2 entryways. Here's one of them, and the other one is on top. So those both entryways will still exist. And so they're just gonna have to turn a little bit. So that chunk that's in there is really Julie Cheaton's English classroom and student reporting lab. But part of the courtyard will still exist so that we don't have to move the sliding garage door, that leads into the auto shop up on top, so, yep. Currently, they just cut right in and go into that door, as opposed to navigating through. So, you can see that we've added in more storage wherever possible, and Julie and her program would get a full recording studio as opposed to, right now, that little thing that says control booth, that is the recording studio. They've got one wall painted green, and that's where they do all of their recording from, but they would actually create like a news desk and a little interview area and whatnot. Her room serves as an English classroom because she does teach some sections of English, but then she also has the Mac lab for a lot of the video editing and stuff, and so that's why you see almost 2 classrooms within one, because one is the Mac lab that the computers stay there, and then the space for the kids to come in for their English classes where they have their laptops with them. All right, locker rooms. So the pink area that you see over by Jill, that is the current band and choir rooms that we are suggesting would become the Phi-Ed locker rooms. Remember that we don't need necessarily to put whole sports teams in there because our inside sports use the field house, but we definitely need locker room spaces for our Phi-Ed kids. And so that need for locker rooms is actually smaller than the band and choir total space, and so we might also be able to create some kitchen storage. At the high school, we store a lot of dry products in that room right there, not at all connected to the kitchen, and so if we could move the kitchen storage, because right across that hallway there is where the rest of the kitchen receiving area is, and so forth. Questions about that? No? No? Go ahead, another question about that?
I was just thinking about the gymnasiums, and was there some concern about not having an outdoor exit for the Sam Young Gym?
So if we're gonna remodel part of this, the Sam Young Gym, pardon me. If we're going to remodel the Sam Young Gym, then we have to bring it up to code and it has to have that immediate exit. If we're not gonna remodel it, then we don't have to do that.
So we're not losing immediate exit with the gymnasium?
We don't have current immediate exit and we're not adding it. So it's really a net zero change to the Sam Young. Because right now you—
No, I'm talking about the
West Gym.
Yeah.
Oh, we're still okay because there is, the exits are right, yep.
That's enough of that.
Yes, I'm sorry, I was not understanding.
And they have 4 exits, so they have this one. I think they have to be proximity to the outdoor exits.
That was my question.
Yep.
Is that was already considered in this, I'm sure. Yeah. But I just wanted to make sure I was remembering correctly.
You know, so I don't know if you guys remember, there's a ramp going up on this side as opposed to the stairs. We actually talked about maybe doing a ramp up on that part because there's that little lift cage that's in there that is an individual person, not like a full elevator. We could eliminate the need for that entirely if we were able to do a ramp, but they said that the number of doorways that come off of that hallway, it would get very messy to try to do a ramp in there. So then I said and Kent got kind of excited really about eliminating the stairs because taking the floor machine down the ramp is much easier than floor machine, clean the stairs, drive the floor machine around and do the rest. So they did say it might be possible to do like it's a wide hallway, half stairs, half ramp if we really wanted to make it handicap accessible. We asked them to check into the cost difference between both of those, leaving it as the stairs or to do the ramp. So. All right, and then we just have Mrs. Halverson's space. There we go. So they had some fun pictures of other family consumer science classrooms and what kind of lab station looking for. And so right now she has the foods lab, and then she has the other room that teaches clothing, interior design, child and family, and just all kinds of other stuff. This is was the weight room where it says PE storage. So we're taking a chunk of space from that PE storage area and making that into storage for all of her different coursework and materials, and then making that part for all of her other classes other than foods, and have lots of storage room. Right now her sewing machines are all portable. They're stored on shelves. The kids go get it and bring it, and she's fine with that. She doesn't feel like she wants to switch to all built-ins or anything like that. Her foods classroom right now is extremely inefficient. They really put cabinets in wherever they could fit them, and a true foods lab is every single station is absolutely identical so that she can say, cupboard on your left, top shelf, and boom, there's the stuff that they need. Instead, it's well, look up on top and maybe it got put in the bottom, all that stuff. So anyway, the other thing is she does not have a demonstration table. She has like a high table there, but it doesn't have a cook station or a sink or anything like that. And so she's looking for a demonstration cooking table up front. And then they had some great samples of just like a camera, like we heard the math people talking about document cameras that would project screens throughout the room, what was happening right there that the kids would easily be able to duplicate. So obviously, our family consumer science used to be 2 full-time staff members, and so I would just say if we were going by student interest alone, we could staff kids in foods all day long because so many kids are anxious to take it, and we have to cap that enrollment because we, there's only one of her and she teaches all those other courses as well, but this will set up both teaching areas that could run independently or certainly could be run by one person. Questions about that?
So what happens with the existing art space?
So there are people in the high school who are living in some very, 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 very small spaces. There's one, so this is Connie Halstead's current special education classroom. She would very, very much love that space across special ed. She has her needs fluctuate depending on student enrollment, and she's got some students currently that have a lot of bathrooming needs, and there's no other space at the high school either, and so a Hoyer lift and whatnot would probably, right now that's the kiln room where it says storage, and that would become part of her special education area as well. Because it already has running water and all of that stuff from being an art room, so we would spot there. Right now our Ho-Chunk tutoring classes are in a room that is much, much, much smaller. Our Ho-Chunk language classes, we've got a lot of people squished into spaces that are too small right now, and so they would get a little elbow room and get to spread out a little bit. Any other questions?
With this COVID and social distancing, you just hear, are we prepared for that again with some new design or something? If we have, say, 90% of our kids wanting to come back and we're in a social distance requirement.
We would never be able to do that in any of our buildings.
Okay. I'm just wondering if they've adjusted any of the design to still accommodate some of the things that we're facing right now.
It's basically more square footage, and that's going to add significant cost.
Sure.
And so we have, we've not done that.
It's never gonna happen again.
I hope so. I hope not.
It's all square footage, right? I mean, because we've got the, we're. So.
Very nice.
All right, we'll keep you posted, and as I said, the first week in January, all the teams will get another look at that work.
Okay, thank you. We have one policy for a first reading, and that is a cum laude.
And honestly, the policy did not have a change. It is the, sorry. The rule does, for certain, to talk about the number of semesters, to go from the, instead of after 7 semesters, it would be after 11 semesters that we would be considering their cum laude points to determine their honors upon graduation.
Any questions on that?
Or trimesters?
Yes. Yeah. It moved to trimesters. Oh, I thought must not be the most recent one, my apologies. In the policy committee, I had trimesters. I'm sorry, I'm not sure why that happened.
Thank you.
Yep, thank you for catching that.
Okay, and next is the school safety drills. And you have those in your packet as well.
I don't know if you want to give any precursor to that?
Any question or comments on those?
Not much of a precursor. It's just part of Act 143 that this came into play a couple of years ago, that we need to now officially fill out a form and have the board approve the drills that we've always been doing. It's nothing new about the drills, but the form itself, I guess, is a little bit newer. This year we took a little modified approach in all of the buildings and kept more in just their classrooms doing their own drills. They didn't have the whole building evacuate at one time or anything like that because of COVID. So we did some modifications there. So
how long have we been doing these particular drills now? Is this the 3rd time?
I would say 3rd. I would
say.
Yes, and I would say that we probably did them before, but this is
yeah.
the school safety grant required the sharing of all of it.
Yeah, I would say we've been doing these types of drills for at least 5 years, at least.
I was kind of surprised that they just discovered that you can't hear on the stage at Forest Street.
I'm not sure that's a new discovery. I mean, we've been told that before, that there's been problems hearing in some of the areas. Did you say that they just found out?
Yeah, and I just, it just seems like if we aren't just discovering it, why have we not tried to solve that issue?
I don't know if they're always on the stage either when they did the drill.
Right,
That's true. I'm not sure. I'd have to ask Melanie that particular question.
That room has always had a weird echoey, I don't know. Cause last referendum, didn't they get a new sound system? No, they did not.
We updated it one time though. I don't know if all of the speakers are working well or not, and that's.
I just had 2 weird questions for the high school. I didn't know what the orange safety bucket was that gets placed in the hall. I wondered what that was, and then what a linear barricade is.
So first of all, the orange buckets were supplies that we gave to all staff members 3 years ago, I believe it was. Just emergency kind of things, like if you lock down, what are some duct tape, first aid kit, a little small hammer if you're gonna break out a window to escape through the window. Just general supplies like that, flashlight, those kind of things. So we recognize at the high school, Deputy Nosfish and I, we really haven't looked at those buckets. And so we asked the teachers to put them in the hall, so we could make a visual inspection of, did the kids sneak and grab the tape, or have the Band-Aids been used? And just evaluated what we had. Of course, when you have new staff, where does the bucket go? It's supposed to be in a nice spot in the classroom, visible, but sometimes staff will move and then they move away, and then the next teacher doesn't know what we're talking about. So it was just kind of a calibration of our safety protocols for that. The linear barricades. This year we focused on the lockdown part of Alice. So we, again, like Joe was saying, we didn't want everybody going outside or chaos where we couldn't control the social distancing. So we focused on the lockdown part of it. And for doors that, open into the classroom, what's a way that you can barricade it? So some just took the desks, put them end to end from that wall to the door, and now you have something a lot stronger than just a wedge of wood or something underneath the door to keep it tight. So we just explore different ways to lock down our classrooms.
Thank you. Kyle loves that kind of stuff, doesn't he? He gets very excited about it.
Yeah, I mean,
helping find new strategies.
Yeah, and just looking at
Alice
things
is
that
his
we don't think
special day,
about.
that's for sure. Thank you. Any other questions on the school safety drills? Looking for a motion to approve the reports.
So moved.
Okay, motion second. All in favor say aye.
Aye.
Aye. Opposed? Motion carried. The meeting minutes from the last meeting, I have, under additions or corrections for that, I've asked Marty to include the roll call names of the vote, so we have a official record of that. We've already discussed that. That will be in all meetings from now on if we need a roll call vote. Any other additions or corrections that you see in those minutes? Okay, is there a motion to approve those minutes with the change?
I'll proceed.
Thank you.
I'll second.
Thank you. All in favor say aye.
Aye.
Aye. Opposed? Okay, motion carried. Dr. Severson's report.
All right, just a couple quick things for you. I wanted to let you know that I reached out to kind of a large group. You know that last school year I was meeting with a countywide truancy task force, and this year I reached out to that group. In addition to, I titled the email Movers and Shakers of people within the Ho-Chunk Nation, really trying to get some more people at the table to do some brainstorming about the significant disengagement that we're experiencing with some of our students, that we have not seen them yet this school year, or they are just attend one class period for that week, and that's about it. At the elementary level, the attendance is counted not just by whether you're clicked on at that time, but also if you are turning in any work or anything like that. And we just have a large number of families that are not, students that are not being successful at this time. I will share that when we broke the data down at the high school level, the percentage of Native Americans failing courses was significantly disproportionate to our population, which is what prompted reaching out to that group to say, recognizing that their concerns with coming face-to-face in the building, is there anything else that we can do? Youth services is not operational right now, and so that is a whole department that used to provide additional services, and so we do still have, we usually contract with youth services through our Title VI funds, so not district dollars that we use for other purposes, but our Title VI funds. We've talked about, could we contract with some of those people? Could we ask to use the Area 1 Community Center in the evenings and supply tutors if students would be willing to go? So really looking for a group to come together and brainstorm, because the lack of credit acquisition is going to have ramifications for graduation over the next couple of years. And I fully recognize that we're in a pandemic and it doesn't feel as important to them now. It's going to be very important to all students as their graduation gets pushed back because of the lack of credit. So I wanted you to know that I reached out for that. Wanted to let you know about the blood drive that just happened. Maddie Dean and Katie Dobson facilitated that with the Red Cross. And they filled all 78 slots in a heartbeat, and they actually had to turn away people who wanted to come and still donate, so that was great. A reminder to the board that while Mother Nature is being kind to us right now, inclement weather days are likely to come this winter, and we did change our practice in that we don't have them built into our calendar, and so I wanted you to know that we're still having discussions in the buildings as to what it's going to look like in each building. Whether we send devices home for K through 8, or whether there are other activities that are sent home. We started talking about blizzard bags last January and February in response to the inclement weather days, and then the pandemic happened, and everyone was like, well, of course we could teach with all the kids at home, but not all the kids have devices, and so are we going to send devices home on the bus with all of our elementary kids when we haven't done that in the past? And so just wanted you to know that they are not built into the calendar. There will be some at-home learning that day. Each building is still working out what that's going to look like. All right. The National Board. Actually, Vicki is here tonight, but I was actually going to share, I had asked for articles for the Tiger Tribune, and I was just blown away by this number, and so wanted to share this with all of you. So Vicki is our school social worker, and Jenna Rosequist is also, she's our Native American student attendance specialist. They have made over 600 home visits already this year to families, working on that engagement piece that we talked about, delivering materials, picking up materials, bringing hotspots, taking hotspots, giving them applications for free Wi-Fi, any manner of other things that Vicki could sure expound on. But I just thought that that was a remarkably high number, 600 home visits, and we're not at the halfway point of the year already. So I was going to share that, and now here you are, so now we can say thank you face to face.
Yeah, that's such support for our families to have that connection.
And then finally, just a reminder to the board that I sent out a notice for Tiger Tribune articles. If anyone has any topics that you would like to see highlighted in the Tiger Tribune, please get them to me ASAP. During break, I'll be writing that up so that it's ready to get to the Banner Journal that first week in January. So those were all of my comments. We had asked the administrators if they would share their thoughts, so I think they're going to come over. But Chris, since you're here, do you want to start?
Tom was going to do
Oh, Thomas, so no, we'll wait for them to come on over. There you go.
Starting with Melanie.
So the first thing that I'm going to share about forestry is that we have started planning our child development days, and obviously it's going to look a little bit different this year, but we are offering both an in-person option and a face-to-face option. And we've already got one kiddo signed up.
You said in-person and face-to-face. We're going to assume that one of them is virtual, right?
In-person and virtual.
We figured. You really wanted to come face-to-face is what you're saying.
That's a nice choice, isn't it? We are going to be holding these days February 2nd, 3rd, and 4th with appointment slots so they can sign up for. And if it should happen to snow one of those days, we'll have a backup snow day, the 2nd, 3rd, and 4th in March. And we are also reaching out to all of those community agencies that typically come in and set up a booth to ask them if there's anything that they would like to include in a packet that each family will take home with them when they leave. And we've got a good response coming from that too, with some agencies reaching back out and expressing their interest.
Is there still going to be collaboration with the Head Start programs so they can screen as well?
Yep, yep, absolutely. So the other thing is that I put together a little video. It's very, very rough, but I just wanted to share some of the awesome work that our teachers are doing. And I've got 3 quick examples for you. The first one is of our 1st grade teacher, Mr. Mick. They are talking in 1st grade about counting by tens by decades, and you'll see him do, I think this is going to start with him. That's not him right there, but
I think it starts with him.
Okay, so you're going to see him like engaging the kids and doing some jumping jacks and some other exercises with them, counting by tens.
To tell you how many groups of 10 there are in the number, and all of our decade numbers end in 0. Good job, Journey. All right, we're going to do some exercises and we're going to count our decade numbers. What should our first exercise be? Raise your hand. What should our first exercise be? Journey. Remember, something we can do standing up. Jumping jacks, perfect. Everybody up. Everybody standing up. We're doing jumping jacks. We're going to count all the way to 100 by 10s. Everybody stand. Amina, wake up. Hayden, stand up. Here we go. We're going to start at 10. We're going all the way to 100. Here we go. 10, 20, 30, 40, 50, 60, 70, 80, 90, 100. All right, let's do another exercise. I want to do some dabs because I know you guys like dabs. Eli, stand up. We're going to dab it out to 100. Here we go. 10, 20, 30, 40, 50, 60, 70, 80, 90, 100. All right, raise your hand. What's one more?
And then another break quick, but there is another kindergarten teacher that's going to pop on here and is going to.
Emma, do you have?
Perfect, thanks, Jill. Thought 10 seconds would be enough, not quite. So she just is wrapping up a unit on story elements, and so they read 5 different. This is the 4th out of 5 different stories on gingerbread people, and they are talking about the setting and characters and plot, and they ask lots of grade level appropriate questions, and it's just exciting to see how vested the kids are in this process too. So.
Have another difference?
Because he was an ornament, not a cookie.
Yeah, that's a really big difference, right? He's the same shape. He looks like the other characters, but he is definitely different. He is not to be eaten. Josie, what else is different?
There was
Emma, go ahead and mute, hon.
in this story.
Can you say that again?
There was candies.
Yeah, there was tons of characters. We didn't get to meet all of them, but there were a lot of candies and treats with eyeballs and arms and legs in our story. That was very different. How about the ending? Did he get eaten, Cassie, like in our other stories?
No.
No. How did this one end?
I'm hanging on to see it.
Yeah, so he went through lots of things that he was not good at, like running and tasting good, right?
Just for the board's information, the math teacher that you met earlier, that's his wife, Melissa Plaza, who also works for the district. So.
And I'm not sure if you've seen those cartoons on the internet that show the stark difference between high school and elementary virtually learning, where at high school they've got all their cameras off, and at the elementary level, kids are showing you their pets, they are telling you fun facts, and they're constantly interrupting for stuff. So I mean, this, you definitely have to take into account the amazing work that the teachers are doing. This next one is Angie Haves, and she's also doing fine motor activity. She's having the kids follow along with step-by-step instructions on how to draw a gingerbread man. And she totally channels Bob Ross in this. These kids were, she would say, okay, now make a circle, and you'd see the kids' heads all go. And so that's this next little last clip.
I'm so sorry. Can you draw some waves? One, and then one right below it. And then he needs 2 eyes. And then I'm going to make him smile. How are your drawings coming, friends? Oh, we're getting there, aren't we? Nicely done, Griffin. All right. Oh, now we need some waves on his arm. 2 waves on his arm. Owen, can you remember to mute, my friend? Thank you. And then we need 2 waves on his feet. And then we're going to draw some buttons, 2 circles. Doing okay, Braylon? Good. And then I'm going to draw a circle up here. And then I'm going to kind of make a shape off to the side. It's kind of a quadrilateral that we've been talking about. It's a little bow tie. Give you a minute to catch up. You are all working so hard. I can't wait to see your done gingerbread.
Always going to tell you how many groups of 10 there are.
So Mary Jo came over and got to see some of our classes in action. If you guys want to ever join in and see what they're doing, it's just awesome, and definitely sometimes entertaining to watch too. But there is phenomenal work going on, and kids are, I put on here, it's our goals, our SAIL goals of being empowered and having student achievement, and they are really doing just an outstanding job of engaging those students and empowering them. And just, you see the students eating out of the palm of our teachers' hands. It's amazing to see.
Thanks for taking those videos. That was fun.
Yeah, thank you.
Bring it in.
All right, good evening. I know that you were promised Laura, but you're stuck with me.
It wasn't a promise, it was just a thought, sorry.
So, just look at the notes here. So I know this was mentioned by Shelly and a couple times tonight. I think Stephanie mentioned it as well, but since they live in our building, we wanted to congratulate Vicki Kramer and Christy Roush on passing their national board certification. There's a lot of work that went into it. It's a year and a half in the making. A lot of data collection, a lot of videoing of themselves, going back, analyzing themselves, fixing it, analyzing it, and going back. One statistic that always sticks out to me whenever we talk about this is on the final exam that they have to take, there's a 50% pass-fail rate, and both of these 2 ladies passed on their first try. So that's very impressive on their part. So we're very proud of them, and we had a little celebration with cake and punch today. Number 2 is virtual student engagement. I really appreciated Melanie's videos because that's what it is. It's sometimes hard to engage these students all the time virtually. We see 2 of our teachers here. They're doing a sticker on the face method. If the kids answer a question right, they put a sticker on the face in order to keep them engaged, I guess. It's not always easy. We've, as Melanie kind of alluded to, we've had to wake up students. We've called them at home. Our teachers have had to check in at home in the middle of their lessons, those sort of things. She mentioned at 4th Street, the kids are always up and engaged and ready to go, and mentioned at the high school and the middle school, most of the cameras are off. We get a little bit of both at Red Creek being in between the 2 buildings. We've met a lot of pets. A lot of pets. We saw a pet alligator. That was pretty cool. And again, invite you to come join one of our virtual classrooms. There's a lot of work that really goes into it that you'll never really appreciate until you get the chance to go in there. One thing that popped up to me watching Melanie's video is the wait time that it takes for kids to answer questions. Even when we're in person, it's often hard to not all talk at once. Now try doing that virtually with 30 students in there.
When adults can't figure that out, right? I mean,
Yeah,
that's
exactly.
a tough thing with the virtual, yeah.
Yep, and we have 7 teachers that are going to continue being full-time virtual teachers through the upcoming future. Next up, we've heard over and over again how terrific it's been to offer childcare for our staff members to relieve some of the anxiety that they have about virtual teaching. You can see it in this picture. This is our art room that is set up as a virtual learning center for our childcare students. They're all 6-foot spaced. We were able to use the pull-down outlets for them to use to make sure that their Chromebooks are charged fully. You even saw it in one of Melanie's videos. One of the students that have flashed you could see 2 of them next to each other. And it worked out really, really smoothly. And again, the staff appreciated it. We got tons of comments over and over again about how great that was in order to offer that. I think Laura's even fielded some calls about how we were able to make it happen from other school districts. They're looking to copy the same model. Our staff members understood the reasoning behind needing to go fully virtual, the state that we were at and the percentage of teachers that were out, but they're all happy to be back. What you're looking at here, this is an actress who is giving a behind the scenes look at what it's like to be an actress through a Google Meets video. And to the right there, those are all the students that are watching. You can see some of them have their cameras on, some of them don't. They're blurred out for privacy issues, but that's what it is. Every day, that's her little workstation. That's what she goes to. It's hard to do that when you're used to being in front of kids full time, all the time, to just switch everything on a dime, learn all this new technology, get your new setup, and make it happen. And our teachers have done a phenomenal job. When we come back, it's going to be a lot like starting over. After a summer break, there are rules and expectations that the teachers spend time teaching their students. It helps in the long run to make sure that they're following all the expectations that the teachers are looking for. We're going to have to reteach a lot of that stuff. What you're looking at here is our behavior intervention pyramid. The bottom is our universal systems and supports. We're going to have to go through the instruction that all of our students get over again. And then the paw to the right is our tiger traits: be respectful, be responsible, be safe. All these reteachings are going to have to happen in order to have a smooth transition into the end of the school year. Any questions? Happy holidays.
Thanks very much,
Thank
Brandon.
you.
Good evening, everybody. Just wanted to give you a little bit of an update from our virtual stint that we've gone through. We had a staff members daycare at our school this year that worked out very well. We housed it in our middle school library. We had 15 students daily, and 1 student actually was up from outside the district. All students were socially distanced with their learning materials, Chromebooks, and headphones. Mr. Ossegard did an incredible job setting up activities in a separate area for our students to work on during downtime, including puzzles, games, hand-eye coordination activities, robotics, the list goes on. We also had tech ed, our PE-based activities. that we had set up for our students when they had special times. This opportunity for the students was a great opportunity. It worked very, very well for our staff members' children. They were well behaved and engaged each and every day. Our staff did a great job getting this set up. We were really happy with the results. In addition, our internet cafe was held in our middle school commons. We had 4 to 15 kids daily. We had 24 different students that utilized our cafe. We had elementary, middle, and high school students that used it. It worked very well with some of our students who were otherwise disengaged at home because of poor internet connectivity. And for some of our students, this turned them around 180 degrees.
If I could just stop you for 1 second, Dan. So some of our neighboring districts, when we talked about providing that internet cafe, they said, we set it up and we offered it and nobody ever came. And so it was a very short stint. Repeatedly, when there were students that were disengaged and the teachers would call home and the parents would say, well, I can't make them pay attention, I can't blah, blah. Repeatedly, they invited them, come on in, come use our internet cafe. And so the fact that they had very, very regular attendance, that was highly unusual. Most districts did not continue offering that because people weren't taking advantage of it. So I appreciate that the teachers continued to offer that as a resource for parents who were getting frustrated. And even though there wasn't tutoring happening, the kids still felt like they were in school, and so their engagement in their academics really, really increased during that time. So thank you.
That occasional gentle nudge when you walk by and tap on the shoulder, say, hey, you're doing a great job, let's keep it up, you guys. When you're at home, it's really easy to turn your microphone off and lay your head back down on the pillow and take a nap, or go get something to eat, or watch TV, or play a video game. When you're at school, it really helped with their engagement, no doubt. And I would say that a majority of the students that did come were intentionally invited by our staff members. So again, it worked out really well. This year, to start our year, our behavior task force, our PBS crew, started a slideshow about student expectations, and as well as student expectations, we had some teacher expectations there as well, to get us started off on the right foot. It was very, very beneficial. We saw a lot of benefits from it. This year on January 4th, our behavior task force will roll out and launch another middle school behavior expectations for our middle school students. This will be a slideshow presented and discussed at all of our focus rooms. The 2021 school year started out great, and we want to end the year on a note that we started the year in. When our students return on January 4th, we will reshare the expectations and protocols, just like we did in the beginning of the year. So I'm looking forward to it, and we're looking forward to a fantastic second half of the year. Thank you.
Just for the board's information, I had asked all of the administrators to start writing down all of their comments for the district admin report, and so they had some links so you need to put up there. But this, after the evening, Marty will go back and put this in the Moodle as well, so that you have all of that documentation as well. Hello, Mr. Chambers.
Hi there. Shelley didn't realize what she was asking for when she asked us to write it all down.
I started looking at the list, I'm like,
wow. A lot longer when we write it down than just shoot from the hip. So,
it's quite a confession, you know.
I mean, when we prepare it.
Yeah, okay, right.
So from the high school perspective, I just wanted to share 3 brief things. First, the return to school plan was discussed by our building leaders this evening, or this afternoon, after quite a bit of conversation in the building last week, just to look at what we have done so far this year with first trimester model and then the current lockdown model. We looked at some data, we looked at trends and things that worked well, things that didn't, and discussed how we would set things up, and it was decided that we would keep it very similar to both of them blended together. So in other words, the Wednesdays would still be the day when students would have virtual days. However, we would do what we did during this lockdown, and as Shelley mentioned before, with the students who were struggling or students who needed extra help, to really get them to come in and work directly with the teachers, work in small groups, work with individual teachers and support staff, so that they're getting the help that they need. The teachers really thought that was effective when we were doing it, to do it on a Wednesday, give the kids a couple of days to get instruction, to get started on things, get to where they have questions, and then have an opportunity to come in and meet with the teachers and get that individual help. When we did look at the data, actually, it was interesting because the gaps, the learning gaps between those students who came in and the ones who didn't, actually closed it was a lot closer, a lot smaller gap than we've seen in the past between those two groups of students. We also talked about continuing the internet cafe. I also overheard there was some discussion about the internet cafe. We talked about continuing that, continuing to offer some evening hours, staffing it with our staff, and providing that those extra opportunities for kids to come in and get assistance. There was also a proposal, and we're going to look into this and talk more about it, to set some of those out in some of the outer lying communities, so in Hickston or Hotep Nation or other places in the community, to have that available there. And we had a brief discussion about summer school opportunities. Again, as Dr. Severson mentioned, we unfortunately through this have seen a higher rate of failures or students not earning the credits necessary to graduate, and so we want to create opportunities for them to be able to earn those credits back once we get into a situation where we're hopefully able to be more face-to-face, and so we're exploring different ways to offer summer school opportunities where students be able to earn more than they typically have in the past. In the past, it was a maximum of 1 credit that students can earn in the summer, so we're looking at different models to try to increase that to provide some opportunities for kids to earn back more credits. Also looking at possibly making some adjustments to trimester 3 so that we're able to really specifically offer those courses that kids might need to repeat prior to the summer so that they could actually pick up some of those. It would of course mean they would have to probably forego some electives, but better to forego electives and graduate on time than the 6-year plan or 5-year plan. And the final thing that I'd like to announce, Mrs. Leadholm came leaping down the hallway today and jumping up and down outside my door. She was ecstatic because she'd received an email from Susan Kapanke, who was a representative from the Daughters of the Revolution chapter in La Crosse, and Maddie Dean, our student, received the DAR chapter from La Crosse. The Rebecca Myrick chapter in La Crosse received their scholarship this year, which means that she now goes to the state for the competition there. And Mrs. Kapanke wrote, I quote, "One of the judges wrote a note stating how impressed she was with Madeline's paper. I read it," and she's a former English teacher, "and I agreed, and I thought it was outstanding." So that was
Sue has said that every single year she's worked in the district, they've nominated a student. This is the first time, and she's been here for over 20 years, yeah, that a student has won it, so she was super excited. I didn't get the visual leaping, but I got some enthusiasm. But you can
imagine that with Miss
I felt it. I felt it for sure.
Yeah, the Daughters of Revolution, as the name implies, is quite an old organization, and we have been providing scholarships to students for many, many, many years, and so it's a very prestigious award. So congratulations to them.
Thanks. Thanks very much. Thank you, Don.
Good evening. Each time I come, I always talk about how proud I am about all of the students over at Gephardt School, but tonight I wanted to take a different approach and talk about some of the other programs, because we're filling up our building. And so there's lots of other things over at our building, but the one I wanted to really highlight today is Vicky's program, and Vicky is actually here tonight. And she, along with the home visits, we have a clothing pantry, and I'm not sure what else to call it, but just kind of a clothing resource, and they offer not only coats and jackets and boots and different things to our students, but they also have school supplies and personal hygiene products and all different kinds of things that they offer to our families. And they just need to call our school and set up an appointment, and Vicki either meets with them or she sets up a time for them to come back, and it works out super nicely, but it's a great resource. And so over at our building, she's kind of taken on a couple rooms where Dr. Severson used to have her office over there and spread out and have clothing, but I don't know if there's anything you want to add, but it's been a great resource, and we have a lot of families that are using it more than I've seen lately.
Yeah, we don't have really a thrift store in town, and so there isn't an easy place for families to find cheap clothing. and so it's all gently donated stuff from the community, staff members. So I go through it and I hang it up and organize it by prize, and they're invited to come in anytime I hear them meet to take a look at what we have, and they can take whatever they need.
I was on Facebook and somebody on the marketplace, there's a Jackson County Pay It Forward, and somebody was looking for gently used children's clothes, and somebody said, did you try the Gephardt office?
Yeah,
So that's good that word is out.
Great resource, and so we're getting more and more families that are using that resource. And then I guess I want to close by highlighting the special ed team in the district, because I truly, through the times that have been going on, we have still continued to bring in students and provide servicing, and right now we're up to 143 students that we have coming in providing therapy and individual servicing to, PT, OT, the reading, the math servicing. Some are coming for half days, full days, and the staff has done an amazing job of turning that around, as well as rewriting every single one of those IEPs and putting that into their IEPs. And so I just kudos to the special ed staff in this district, because they have done an absolutely amazing job of what they've done.
And they've appreciated the time to be so focused on just that one student, right? Like, I mean, the numbers that she gave, those students have been bussed in and transported during all this time of temporary closure. Those kids have continued attending multiple times a week, and it's been really good stuff.
Yeah, and I would say that, again, the students have gotten a lot of individualized time and attention, and we've been able to really drill down on some of the skills, and so they haven't lost any of those skills through the closure. And so we've really worked with each family. If they weren't able to connect virtually or in person, we've done packets, and so I really feel like we have gone and done everything we can to service those kids in our district. So that.
Thanks, Kim.
Thank you.
Thank you.
Next item, WAFD, I have nothing other than a repeat of the convention, and let Marty know if you're interested in doing the convention. I think it's gonna be a good one, and everything's underway. Conference and workshop attendance, anybody? Okay, and school board connection opportunities, we added this to just talk about, we've heard about observing the virtual classes that's happened.
So January 5th is our special board meeting that is scheduled, and so perhaps that night you could bring calendars and we can talk about when to go, because tomorrow's the last day with students before break, and so I'm not sure tomorrow or Monday, January 4th is the best opportunity, and so we could certainly schedule something then.
Okay, and then just a reminder that our board member appointment process is still open. It will be until the 30th, and we'll be choosing a new board member or appointing a new board member on that Tuesday, January 5th meeting, as well as reorganization to, with Scott's exit, we're missing a vice president, so we'll be doing that business as well.
And the school board self-evaluation that
Yes.
hopefully you've clicked through.
I did want to just tell a little bit about what I saw too on my virtual.
Okay.
Amy, I heard you say can you go watch it? I wanted to watch it too, so I started with Red Creek, and I went to Red Creek and I visited with teachers and sat in on their morning meetings. And I thought, wow, look at all these little kids, you know, they're engaged, everything. I talked to Stephanie Calls about music, and she's doing like to Jingle Bells, these cup stacks and things where the kids are all doing these different things. It was really cool. I found out that the kids in daycare are specialists or encore teachers, is that what you call them now? Yeah. They do provide instruction for those daycare kids too. They give them, so that's going on. There were just so many good things. The teachers were so involved. And I was just really excited. Then I went to the high school, and then I was talking to teachers there, and you get a different experience because their cameras are off. So can you imagine teaching to a blank screen of kids all day long? And then Mike Shepard followed up with, after I talked to him, and he gave me data on how many kids were actually participating, you know, 6 out of 10 were engaged, or 8 out of 12. They've got their video screens off and their mics off. So it's very tough to get those kids engaged. So I found that process, the difference between those two levels were immense. So then I said, I wonder what's happening at the middle school. So I ended up going to the middle school, and they've got a different policy where they have to at least check in with their faces. You know, they have to check in, and they also were using a program that they could put fake backgrounds behind them, so that the kids in the high school, a lot of those kids don't want their peers to see where they are. And middle school was now using, programs where the kids could put a fake background, and they taught them how to do it, so I thought that was really interesting. What?
On the beach?
Well, yeah.
Wherever you wanna be.
And then one teacher had, I don't know if it was, the name was Archimedes, it was something like that, where they could actually see, this teacher had 3 screens on her problem, and one of them, she could see exactly what every child was doing on their computer. You know, so they couldn't fudge around and do all these odd little things. One thing at the middle school I thought was really cool too is, you know, I asked about music, Patty, you're just, are the kids able to do the music? And they said, no, they're working on those socks, you know, for the instruments. But Troy Tandy, before they went virtual, they had ukuleles, and they're all learning to play ukuleles and different things. So that was really cool. And then I also went to Forest Street and saw those kids like Melanie was showing. I saw quite a few of those teachers. It was really fun to see how the kids are engaged, but that wait time. You know, you can only probably get 2/3 of what you usually get in because of the wait time, waiting for them to turn in and on and off. But it was just really neat to see what our teachers are doing. They are really doing a nice job. I was totally impressed on the tactics they were using and the different methods. I would encourage you, if we have to go back to virtual, to go in and see that. The teachers are very appreciative of me being there, and I think they would love to see everybody there. So it was cool. I learned a lot.
Okay. Thank you. I was reading an article about the virtual instruction, and they said one of the cool opportunities that it provided was that it's disruptive to make comments or whatever during, you know, in a regular classroom setting. But if they can have a chat room going on at the same time as the virtual, then people can make comments as they're going along without being a distraction to the class. And they found it helped with the engagement.
Absolutely. And so that is always a choice as well. A lot of the teachers have really gotten good at using the breakout rooms as well, and so they can have those small group small group discussions by putting kids out into the breakout rooms, and more kids are willing to click their camera on when they're in that small group room than they are when they're in that large group room. The challenge is when the teacher is also sharing their screen and doing a bunch of other things, it's hard to also monitor the chat. If you know, you get too much going on in front of you, it's hard to try to see the kids and what you're doing and all of that stuff, but absolutely.
I felt like they had to be octopuses with all the things that they were managing.
Yeah, there's a lot going on, that's for sure. That's for sure. And so just a quick follow-up to that, there were some teams of people that were just celebrating that everyone's coming back face to face, and there were some that were not nearly as excited about it because they're concerned about numbers, concerned about a lot of different things, and the high school model with the kids in front of you and the virtual at the same time is still our greatest challenge. That is, and so we've said to them, ask all of your colleagues, ask anybody else that you can find that has got other solutions here, but everywhere else we've been able to separate the two so that they're not having to do both at the same time. That's really a whole new level of challenge. So.
Okay, for future agenda items, we have a pretty full agenda for our next special meeting planned. Is there anything else to add to that?
Or for the regular January.
Or the regular January meeting, yes.
So I'm assuming it was a mistake, but instead of future meetings, it said the 23rd at 5:30, and I'm assuming that was supposed to be the January 5th meeting at 5:30.
Sorry. Oh, I had this done before I had all of your feedback on the doodle, so sorry if that's what you mean. The January 16th thing listed on here, or where?
No.
On the upcoming dates.
Yeah.
On the last page of the agenda.
Yep.
It says December 23rd, and then there's no date, and then there's 5:30 special board meeting.
Oh, because you know what, after you guys finished the doodle, I was gonna go back and fill in the date, and then I sent this to Marty first and said I'm done before I got back on the doodle. It is January 5th, my apologies. So the break is correct, and it should say January 5th, 5:30 special board meeting. My apologies.
I just want to make, that's what it was meant to be. Right?
Yep, I left it blank because I was gonna wait for those last two, and then got ahead of myself and said I'm ready, Marty, and I wasn't, so.
So I guess, I don't know that this is necessarily something we are gonna be talking about like at the next meeting, but obviously with instruction being so back and forth, and it's obviously going to create gaps in what these kids are learning. And I just, in my mind, I'm thinking, well, at what point do we decide we need to give our students extra time to get caught up? I mean, they, at some point are gonna have to go on to a secondary education, and they're gonna be so behind in what they would normally have in terms of instruction because of, you know, you can't learn the same virtually as you would in person. And
not all kids can learn the same virtually as they can in
I would
person. I mean,
say
let's be
most
honest,
of them.
because there are some people who choose this pandemic or not, right? I mean, there are people who successfully do virtually. So, yeah, absolutely, we've had discussions about how do we manage this, right? I would say that it is not that different from, we've always had the challenge that the high school level is the only one that they have to acquire credits, right? And so every level before that, we work like crazy to get them to meet the grade level benchmarks, and we know that we're not there each time, but high school is the only one that there's any teeth to that.
And nationwide, I mean, everyone is going to be experiencing this, so I mean, it's going to need to really.
The other thing that I would offer is that we've really pared down to some of the essential elements. You know, there's some of the stuff that is being missed is a lot of the diverse offerings, like the fact that our middle school kids aren't getting banned and what, you know, I mean, so some of that stuff is the first to go. There's no doubt that we've got some holes to fill, but I'm not sure that we're gonna feel it in quite the same way. You know, I feel like because it's such a drastic, it's not like one or two kids, the entire classroom, it's not one or two kids that are like 3 grade levels behind, it's the whole classroom that needs to accelerate faster. And so we're gonna watch that iReady data as we move forward throughout the years. It's like the younger they are, the more opportunities we have to make up that ground. As I said, we started brainstorming about high school kids because those credits are gonna hit them within the next 2, 3, 4 years. It's gonna be an ugly, how do we get them ready to graduate? So absolutely conversations that we continue to have, and I think using our universal screener data is our best tool that we've got to keep measuring that progress or lack thereof, right? You're absolutely right, there's no way you can get all the same experiences in less time. There's just, yeah.
So what were you looking for, Amy?
Well, I just am kind of wondering what the thoughts have been and what we might do about that.
There are some parents who've asked if they could just unplug from us and just retain their child. The research on retention is not supportive at all. So
doing what? I didn't quite catch that.
they want to just like say, we're done, we're tapping out this year, all done, and they want to come back next year in the same grade level that they're in now. Absolutely. The research on retention beyond K1, there's just really not much positive net gain. But again, that is more of a conversation if there's 1 or 2 kids as opposed to the whole grade level, right? So I guess I would ask Stephanie's had a lot of conversations at her SIS meetings about how we focus our curriculum to the essentials, and perhaps you'd like to give a response.
Yeah, I can definitely put some things together for the next meeting and share some of the intentional work we're doing already.
Because I just didn't know, does that mean, you know, you give kids an extra year or 2 of instruction? Does it mean you try to do a year-round thing where they take those 3 weeks off and that's sort of like the reset, kind of like we did over this break, just to get people healthy again and so they can come back in full force? And I just don't know.
And the spot that we're in is that because there is still a pandemic, it's tough to require everyone to come physically back. So as long as that virtual is an option, we're gonna still have, you know, some people that are not engaging. And we always have some people not engaging, it's just that the numbers are so much greater in our current environment for sure. And so, yeah, Stephanie can certainly share some of the stuff that they've talked about. Because with all of those options, even the conversation about a more robust summer school, we have got phenomenal staff members, but we're not gonna ask them to work for free. And so then it becomes salaries. And so if we're talking about year-round schooling, how are we paying for, you know, I mean, there's just so many components to all of it, but, yeah. And to your point, we're not moving alone. There's a whole system trying to make adjustments along the way. So I've got that on the list for Stephanie to share some of her conversations for next month.
Anything else? Any other Okay, is there a motion to adjourn?
I move to adjourn the meeting.
Second.
For a second, all in favor say aye.
Aye.
Opposed? We are adjourned. Thank you.
Amy, you were talking about the January regular meeting, right?